We are live.
Dr. Avnish, we are live now.
We'll start. Yeah, good evening, everyone. Welcome to the third session of our AIOS-YOSI program. For today's the first session and first day of the two-part program. And the first session for us today is what's new in my specialty, where we have different speakers and panel discussing on their respective specialties. I would like to introduce our moderator for tonight. We have Dr. Cataract, who's the RIO, and he's
I think he's lost. So good morning, everybody. Good evening.
Audible? Hello?
2021. And
yeah. Can you take up Dr. Karan from here?
Yes, I'll take it up. So our first session of this planned event, and we are extremely grateful to Navata ma'am and AIOS and Mahipal sir for giving us this opportunity. Our first session is what's new in my specialty, and myself and Avani.
Our first session of this.
The first session that we'll be taking up is the cornea and refractive session, and I'd like to introduce our panel for that. We have Dr. Aditi Ghosh, who's ocular surface and cataract and refractive surgeon, who's trained at SN Chennai and also worked at SN Kolkata. She's currently working at Batra Hospital, New Delhi. Dr. Kunal Mandlek, who's a cornea consultant at Arvind Eye Hospital, Pondicherry, and myself. And our speaker today is Dr. Gunjan Budiraja, who's a cornea fellow at Dr. Shroff Charity Eye Hospital, New Delhi.
Should I start sharing?
Please start.
Yeah. Good evening, all, and thanks AIOS-YOSI Forum for giving me the opportunity to speak today on the topic. I'm talking about what's new in cornea and refractive services in this update. I'm Dr. Gunjan, and as we all know that in the new times, we have just become like children. We're using hand sanitizers and masks to cover our faces. So besides that, newer things that have been introduced recently in the ocular microbiology is the novel use of trypan blue staining in corneal scrapings to help in visualization of the KOH and fungal hyphae that are more evident with the trypan blue. Coming on to various techniques on collagen cross-linking, as we have all knew that we have a set limit for corneas for which corneal cross-linking can be done. So DSEC lenticule assisted CXL, and now we have a slit lamp based CSL with a device which is CI device. Also contact lens assisted CXL and intraday stromal pocket collagen cross-linking has been introduced new. The collagen cross-linking has also been used in microbial keratitis in the past as well, but the new update is that in a lot of advanced non-resolving microbial keratitis patients, we can have this new technique that is helpful as an adjunct also. Then coming on to the rose Bengal photodynamic antimicrobial therapy for patients with progressive infectious keratitis. So this is a good device which uses a green LED, and it is helpful in adjunct treatment of infective keratitis patients and is showing a very good result in the patients. Now coming on to the transplantation techniques, this is a Bowman layer onlay transplantation to manage the herpes corneal scar. So we can see that Bowman layer transplantation, as it has been already used in keratoconus patients, but now we can use it for corneal scars as well. There's a sutureless femtosecond laser-assisted anterior linear keratoplasty using a bioengineered cornea as a viable alternative to human donor transplantation for superficial corneal opacities. As we all know that in the COVID situations, a lot of eye banks were not functioning. So this newer bioengineered corneas have shown promising results as well. So corneal bioprints have also been introduced, which are collagen based, and they can be also used for the transplantations techniques when there's a dearth of tissues. Artificial corneas have also been discovered now, and they are being designed from the silk dry cocoons, and they have shown good results as well in rabbit eye. So maybe they will come sooner in the commercial use. Coming to diagnostics, the artificial intelligence is not new, but it has been useful in hyphae detection based on confocal microscopy, and it has also shown a lot of results in the centers which are located away from the tertiary centers. So a lot of optometrists who are staying in 2-tier or 3-tier cities can also share normal and abnormal confocal corneal images as well. And teleophthalmology is not new also, but then this confocal can also be useful in advanced treatments. Coming to the treatment of corneal endothelial diseases, the ROC kinase, that is the ROC inhibitors, they have shown promising results in patients of endothelial decompensation. They come in two forms, which is repositional eye drops, and they have shown promising results in patients with corneal decompensation. And injections have also shown results in patients with clearing of the corneas. Coming on to Decimate stripping only for a chronic Decimate detachment after cataract surgery. This is also a new technique that they have shown in chronic results, in chronic Decimates detachments causing corneal decompensation. So in this, we can just remove the Decimate strip and in the central area, and the newer restoration of the endothelial barrier comes again, and patients have clearer corneas in the follow-up periods. Coming to the ocular surface, these are not very new, but yes, definitely these are growing more advanced now. That is the bilateral LSCD patient with wet surface. We have post-allogenic, which have SLET, CLET, and we also have Boston type 1 K-Pros and type 2 K-Pros. Then there's the LVP K-Pro as well with modifications. Then, as I talked about CLET, which is a cultivated limbal epithelial transplantation technique, from which we can also use for the techniques in LSCD. Coming to the refractive, the corneal inlays for surgical correction of presbyopia have also been very useful now. There are 3 forms: camera inlay, which is implanted in the cornea. Then we have raindrop near vision inlay, and there's a presbya FlexB micro lens. So these are newer techniques in presbyopia management. Thank you.
Thank you, Dr. Gunjan, for an excellent presentation and getting us update with what's new in the specialty of cornea and refractive. Dr. Aditi, would you like to comment on this?
Excellent presentation, Gunjan.
Thank you.
And as always, cornea being the most, I think, highly evolving and interesting field for us. Wonderfully, she has covered all, and even in ocular surface, like for amniotic membrane transplant and all, AmSurter is a device. I think it has been launched by Oro. So it is very easy to use AmSurter. So we can use it on table for patients of SJS, even in beds. So it is pretty, helpful. I think that is one more thing. And otherwise, I think beautifully covered. And I think Kunal.
Dr. Kunal, you must be seeing, because since you are in Arvind, then Arvind has a lot of patients, a huge variety of patients that come to Arvind Eye Care Systems. So what do you think, because can something like this be done, on a study basis in Arvind, and your comments on the presentation as well?
Thanks, Karan. Gunjan very nicely presented the recent advances. And for your, we are already working on a RCT, as Gunjan told about CXL used in bacterial keratitis. We are doing an RCT trial for that. And we have started using Ripacidil drops, and we are seeing very good outcomes in Fuchs patients who have non-resolving edemas. So Ripacidil is still it's working not only in the glaucoma field, but we have started using in the cornea as well. We are planning a trial for that also. We are just doing a pilot study.
Dr. Namrata Sharma, the professor from RP Center, AIMS, and the secretary of the All India Ophthalmic Society is also here with us. Ma'am, are you working currently? Any studies are going on in the All India Center for regarding Ripacidil and other such innovations?
I think it was very well covered by Gunjan. She covered almost everything, and we are doing a lot of studies related to the bioengineered corneas, by use of bioengineered cornea for intrastromal keratoplasty using femtosecond in cases of keratoconic corneas. I think Dr. Rajesh Sinha is also here, and he's doing a study on biolenticule, which I think he can tell about. Apart from this, something that is going to come for us in future is going to be the no dissection smile. That is, when you do a smile procedure, you wouldn't have to dissect the anterior and the posterior, lamellae, and it will be anterior part and the posterior part, and it will be such that it will get vaporized inside only. So without having to just dissect, you will just have to pull it out. So that is something which is going to be coming new. And then exciting is cornea 3D printing, which we all are working on, and work is also going at our center on that. And another thing which we are working on is SOMAT. So SOMAT, like COMAT, is your cultivated ocular mucosal epithelial, like SLET is your simple limbal epithelial transplantation. SOMAT is simple oral mucosal epithelial transplantation. That means oral mucosa without having to go into the lab, but just growing in vivo on the eye. So
RP Center is also working on, ma'am, natamycin clear solution, right?
yes,
Is it, because we are desperately waiting for it?
I know we have talked to Sun Pharma and Microvision about this, and Microvision is most likely taking it up, and it will be there very soon. Rajesh is there? I think he was here. I can't.
Yeah.
Rajesh, would you like to comment on your lenticule study?
Yeah, actually, the one thesis that we are doing right now, almost completed, is the use of intrastromal lenticule in cases of keratoconus. The basic idea is not only to provide tectonic support, and but also to flatten the central cornea. And this is actually what we are doing is we use a sort of a reverse geometry kind of hyperopic lenticule for flattening the central part of cornea. So we create the hyperopic lenticule, and then we insert it by creating an intrastromal pocket. So this we did with a 7mm lenticule size, but the results we have analyzed and will come out with it. But another thing that now we have felt is that the results of a larger size lenticule will have a better outcome. And so another project we are doing using a 9mm lenticule intrastromally. So this is something which we expect that it will help in cases of keratoconus to, and along with that, we also do cross-linking, wherein we infuse intrastromal in the pocket riboflavin, and then we do cross-linking. We found out in some of the cases that the demarcation line was quite deep down. So we are hoping that it will have a good tectonic support, as well as a little bit of central flattening effect as well. Let's see how it works.
Thank you, Karan. I think you go to the next one. So that
thank you so much for the panel, and Dr. Namrata Sharma and Dr. Rajesh Sinha for giving your valuable inputs and blessing us with, blessing us. Next, we'll take up pediatrics. Dr. Avanish.
Yeah. So for the topic of the pediatrics, in which the esteemed panelists, Dr. Devanesh, Dr. Pradeep, he's a pediatric and specialists at Calcutta, Lions, BVI Hospital, and Eye Center. And we have also Dr. Pooja Fogri. She's a freelancing pediatric ophthalmologist and specialist in Mumbai. The speaker for this topic is Dr. Rajesh Kapoor. He's a consultant pediatric ophthalmology and strabismus at VI Hospital.
Yeah, I hope my slides are visible and I'm audible.
Yes, Rajat, please go ahead.
Yeah, so good evening, everyone. At the onset, I'd like to thank the YOSI board members and the AIOS board members for this opportunity. So I would like to discuss what's new in pediatric ophthalmology. Many would believe that pediatric specialty is probably the one which is the least, changing specialty, but it's not true. So today's talk will be covering the following headings: amblyopia management, the latest in myopia, the latest imaging techniques which we are using for strabismus, new advances in pediatric cataracts, and surgical part of strabismus. So with respect to amblyopia, as we all know, the general modalities for treatment are patching, and it can be using occlusion or pharmaceutical. So some of the other modalities used are perioptics, cam simulator as shown in the picture, vision stimulation exercises, pharmacotherapy, liquid shuttle, crystal shutter glasses, and iPad-based exercises. So coming to the medical management, levodopa has been tried for the treatment of amblyopia. Many studies have been done on this. The basic mechanism is that it increases the age of plasticity. So even beyond the age of 8 to 10 years, which we consider the age of plasticity, we can still stretch and get some effect for the amblyopia therapy. However, many studies have pointed that it adds an adjunct to the routine occlusion therapy, but not independently, it cannot be used. Then for the refractory and residual cases where the challenge begins, we have tried combined optical and atropine penalization. So this is called as the code therapy. And an in-house study from our institute showed that there is definitely a better improvement with the combined therapy when we use atropine once a day, 2 times a week, along with patching whatever hours we have decided. So it definitely gives the adjunctive effect. Liquid crystal shutter glasses, also amblyos. There's a shutter in the glass where it alternates between an open state and a closed state. It's better tolerated by kids and shown to have good results. But the newer modalities revolve around the dichoptic exercises. So because of poor compliance of kids with patching, atropine with its own side effects, so we have moved towards the dichoptic exercises. Here, as you can see on the image, the child is given the simulator, and on the normal eye, which is the left side, there's a low contrast objects have been shown, and on the amblyopic eye, we give a high contrast objects. This leads to binocular summation of images, and gradually the contrast of the amblyopic eye also increased. Now, coming from the eye pad, which is like the eye patches, to the iPad, which we all know now, many therapies have been now coming on the iPad, especially some games, which also have shown good results. I'm not going into details of that. Coming to the myopia management, this is a real problem right now with the COVID pandemic which we have. And so now we all know that there are both genetic and environmental factors which involve the development of myopia and progression of myopia, and associated with high near work. So with the more use of screen, this is now a real problem. And we have done there's a Cochrane review which showed various modalities of treatment of amblyopia, in which they showed that atropine has a maximum effect in slowing the progression. So the landmark studies done for this was the ATOM 1 and ATOM 2 trials. In the ATOM 1 study, there were 400 patients. They used 1% atropine eye drops versus the lubricant group. And this showed significant reduction in the progression of myopia in children less than 2 years. However, this was associated with a significant rebound phenomena after almost 2 to 3 years. This led to the ATOM 2 study, in which they compared the safety and efficacy of 0.5%, 0.1, and 0.01%. And they came to a conclusion that the atropine minimal concentration, which is 0.01%, has a similar efficacy, whereas it has minimal side effects. So as of now, these are commercially available, and we are using it routinely. Coming to imaging, so high resolution CT and MRI imaging has made our life much simpler for complex strabismus. It has led us to find out the various various mechanisms behind complex strabismus, like the one in myopic strabismus fixus. As you can see in this image, we can trace the muscle. This is a quasi-coronal cuts in which we can see that the superior rectus is nasalized and lateral rectus is inferiorly displaced because of the elongation of eyeball posteriorly. And this led us to this group of Dr. Yokoyama to describe the technique of band loop myopexy for treating this. Similarly, other complex strabismus such as thyroid diseases and CFUM, we can find out the status of the extraocular muscles on the quasi-coronal and axial cuts, axial and sagittal cuts, and we can plan surgeries better. Similarly, in trauma, high-resolution CT, we can find where the exact fractures are. This is a newer sequence modality called as Fiesta sequence, which is fast imaging employing steady-state acquisition. This is basically for tracing the cranial nerve pathways. As you can see, the image on the left is the Fiesta sequence, and the right is the normal sequence. And all the like this image shows the oculomotor nerve, this shows the trochlear nerve, and trigeminal and abducens nerve. So as you can see, even the branches of the trigeminal we can delineate. So for very small lesions of the optic nerve pathways, we can pick it up. And coming to dynamic or functional MRI, here we take the scans in the various position of gazes, and it gives us more information about the functional aspect of the muscle. With respect to pediatric cataract, the latest thing which we are trying is the Zepto technology. It's a precision pulse capsulotomy. Many are using it for adult cataracts as well. It is made up of a disposable single-use ninitol ring, which has a suction silicone cup. And this is just a basic step. So as you can see, foldable ring is inserted into the eye in a pediatric case, and it's then unfolded and suction is applied. And once you give the power, that is when there's a simultaneous dissection of the anterior lens capsule, and you can get a very round centered rexus, especially important in cases such as pediatric lenticonus and all those things. There are many strabismus surgeries. None of them are new, but they are again come back in vogue. I will not go into details of all. Muscle transplantation, which was described very early, but now we have started using it for various new large angle strabismus and other complex strabismus. Here, these are just the images showing the steps of surgery. I'm not going to go in details of that. And the newer thing which we are still trying to learn is the minimally invasive strabismus surgery, or MIS. This is done with the use of microscope. Here, the conjunctival openings are made far away from the limbus, and keyhole small openings are made. And all the surgical steps are performed through small tunnels which are created. And almost all of the surgeries can be done using this technique, including recession, dissection, plication, etc. This technique is described by Dr. Daniel Mojon. Recently, he's popularized it. And this you can see is the difference between the incision with respect to the limbal fornix, and these are the misincisions. As you can see, very small pocket keyhole kind of incisions through which this surgical steps are performed. The advantages of this is it reduces the tissue trauma. There are lesser complications, better patient control. And to conclude my talk, I will just mention a brief about the use of fibrin glue. So we have stopped using almost any kind of sutures for closing conjunctiva, even squint cases. So we are using the fibrin glue, which is a biological tissue adhesive. It has two components, which when mixed, they act and they create a glue-like effect. And advantages of this being in squint surgery, that it reduces surgical time, and also it provides better patient comfort. I'll conclude my talk here and open to any questions or comments.
Thank you, Dr. Rajat, for this exhaustive talk. Dr. Nilutparna, Dr. Prachi, and Dr. Pooja, if you can give in your feedbacks for the same.
Thank you so much, Dr. Rajat. You have extensively covered most of the recent advances that has been going on in the pediatric ophthalmology and strabismus department. And it is really wonderful to see that we have come up with newer technologies for treatment of amblyopia, as well as the use of atropine for to slow the progression of myopia, and even the minimally invasive surgeries. There has been a lot a big basket of innovations that has been going on in pediatric ophthalmology. And I think we have covered most of the part, and I would like to ask Dr. Prachi if she has to add something to that.
And hi, Dr. Rajat. It was an excellent presentation. I just have one question for you. For how long do you continue the myatro or this atropine 0.01% in a child? And
yeah, so what we are doing is first, before starting it, we are making sure whether there is progression, actual progression. So we take it in a 6 months duration. If there is 0.5 or more than 0.5 increase in the spherical equivalent or increase in the axial length, that is when we start this. We continue it at least for a year. And after a year, we call the patients every 3 months and we make a note of their axial length and their refraction values. And beyond 1 year, we even have tried to taper the drops as well. We do not stop it immediately. We reduce the timing, and then beyond maybe 12 to 15 months, we have stopped it. But after stopping, we keep them under close watch for 6 months or so. If at all there is any rebound noted, then we restart them.
actually, there's a very big misconception that you immediately said the stop the drops, and they've observed again there is a hike in sudden hike in power. So we have to gradually taper it. I'll pass on to Dr. Pooja.
Yeah, hi, that's an excellent talk. Just wanted to also check, people have started using low-dose atropine even in patients who are, they have a high risk factor to develop myopia. For children who are going to have a high risk factor, though they do not have a documented progression of myopia that has been noted. Have you all started using the drops for the same?
As per our practice pattern, we are not yet using for the high-risk individuals. We are like for family history or sibling history, those kind of patients we are not starting, but those patients we keep under close watch and we monitor their axial lengths and refraction at every visit. And only when there is progression, we are starting. As of now, that is a practice pattern we have followed.
Okay, great. Yes. So a lot of people actually do not necessarily document progression even for a child who doesn't have high risk. They just think high myope hair and it's time to start using atropine because it's the new in thing in market. So I think we should not really start using atropine because we have to monitor the side effects that go on along with it. So there are accommodation or esotropia that may be seen on the post-op with post 3-month visit that we see with patients who started on low-dose atropine.
Yeah, I agree with you. Totally agree with you.
That was a very important point that has been taken up for the benefit of all the people who have been watching this. I would like to ask Dr. Rajat, would you like kindly point out the things like what is the spherical equivalent and the cylindrical equivalent up to which you use atropine, where you should use atropine, for example, like minus 1.5 or minus 2, those kind of children, or would you like to go into orthokeratology for these children? So these two things are some of the questions that they really ask. Or is it a nighttime use, or should you use it in the daytime? Have you any experience other than nighttime use? So these 3 points I think are pertinent to the atropine uses that we have. Could you just
so
throw some light on that?
Yeah, sure. So important points raised by you. As of now, we do not have any fixed particular value of myopia, say 1.5 or 2, beyond which we will start. Usually when the patients come to us at the first visit, we will never start them at the first visit. Even if it is a very small spherical equivalent, say maybe 0.5 or even 1 diopter of myopia, we'll just look for progression. And only when there is progression, we tend to start these drops. That is point number 1. So there is no fixed refraction value at which there's no cutoff as such where we start. That is number 1. With respect to the side effects and the nighttime use and other things, preferably nighttime. But as per our experience, this small 0.01 concentration does not cause much of discomfort, even with respect to accommodation or the routine complaints with the high dose atropine. So we do not we are not very specific about this daytime or nighttime use. So we just advise the patients to use it as per their convenience.
I think we can now move on to the next session. I know there's a paucity of time, but we have to stick to it. So
thank you so much. Yeah, thank you, Dr. Rajat.
Thank you for the panel
and thank you, everyone.
And for a wonderful show. So next we have the cataract session. The panel includes Dr. Nandini Chandak, who is a cataract, refractive, medical retina and glaucoma surgeon at AMRI Medical Center and BVI Foundation, Kolkata. Dr. Shivashish Das and Dr. Ankit Agarwal, who is a phaco refractive specialist at Eye Clinic, Prayagraj. Dr. Rohan Mehra is the speaker today, who is a consultant at the CKI Institute, Saharanpur, UP, and he's also an immediate past fellow of Narayan Nethralaya, Bangalore. Rohan, please go ahead.
Thank you so much, sir. My slides are visible?
Yes.
All right. Thank you so much for the opportunity to Team YOSI for this platform that is with AIOS. So moving in straight away, what's new in the field of cataract? It's an extremely vast field. I've tried to incorporate all that is there. So moving ahead, so first of all, we need to see what the timeline is. So we had started in eye surgery from the naked eye couching from the Sushruta's time. Then we moved on to torchlight, followed by a slit lamp examination, then high magnification. And now we are in the age where 3D surgery is the norm. That is the latest in cataract surgery. So I would take this topic according to the steps of surgery in a cataract. What are the advancements that are happening in each step of the surgery? So first of all, mapping the eye. Now, I've been a sportsman myself, so I'm dividing it into two corners, just like boxing. You have the blue corner and the red corner. In the blue corner, we have the Artivo system from Zeiss, which is a 55-inch 4K system. And in the red corner, we have the Ingenuity from Alcon. Now, the Alcon Ingenuity came in before the Artivo. The Artivo is relatively new, and it is only present in a few centers in the country at the moment. So the advantages that we have of this 3D surgery are that the magnification is there, and it's high magnification without any loss of resolution. The depth perception is enhanced manifold. The next point is extremely important. Operating is at a low illumination, just 20 to 30% of an optical microscope, which is very, very comfortable for a patient, especially when you're operating a patient in topical anesthesia. Also, it adds a new dimension in training because whoever's in your OR is getting the same view as you are getting. It's not like you're getting a view from the tunnel. Everybody around is being able to see at the depth. And we all know in cataract surgery, depth perception is extremely important. Next advancement in cataract is the intraoperative OCT. Again, Zeiss came up with one first, then Hagstrad came in, and now even Lumera has jumped in with the intraoperative OCT. This has more of an advantage in retina, but in cataract, it really, really helps in us making the perfect incision. Now, the incision, as we know, should be triplanar, and looking at the OCT from the cornea, we're able to make that incision properly. Sticking to incisions only, the next step in cataract surgery, of course, after mapping the eye, is making the incision. What we have in the latest arsenal is the video and image guided surgery. Now, how this works is that if you see these two arrows that are made, this overlay of the image, it guides you exactly where you're supposed to be making your incision. So what you can do in this is you make your incision according to the way you want to correct an astigmatism. And it is going to be extremely precise because you will have the mapping of the entire 180 degrees of the eye. Not just the incision, of course, the Virion system is extremely helpful in implanting toric IOLs also to exactly the degree that we need to implant it in. We know that if the alignment is not proper and the IOL shifts places, then of course we lose the toricity that is there in the lens. So corneal astigmatism, it has been reported by Hale W.J. in the Journal of Cataract and Refractive Surgery that it is reproducible corneal entry and the arcuate incisions also that help in reducing the astigmatism. Now, these things are there on your femtosecond platforms, and now with the help of this intraoperative OCT as well, an early wow factor that's reduced phaco power and corneal edema is caused when we use this. So, how do you do the femtosecond laser arcuate incisions that reduce the astigmatism? So, first of all, it's an image-guided surgical planning with 3D visualization. It gives you a real-time corneal thickness. It's a computer-programmed incision which gives you a percentage depth that you're supposed to go at, incision length, and 3D visualization of incision placement. There are many nomograms that are there. The one that we used to use, the one that is widely used, the Donenfeld nomogram. Now, of course, we have the modified Donenfeld nomogram also, which you're supposed to use it according to the amount of astigmatism that is there. The incisions are also titrables. That means they're adjustable during surgical procedures and adjustable post-op at the slit lamp as well. So the next step of surgery, capsular access. Now, this is a field where a lot of enhancement and a lot of advancement has happened. Again, in the blue corner, we have the Catalyst system, and in the red corner, we have the LensX system. These are the main two systems, and I've been lucky enough to have the opportunity at Narayan Nethralaya to be using both. So I can share your experience of both of them. So the thing with the Catalyst, first of all, is that Catalyst makes your rexus extremely fast. Within 1.5 seconds, the rexus is made. Whereas the LensX takes a little more time in making the rexus. But if you're doing the entire procedure with it, that is, you're making the rexus as well as making your chops and your incisions, then both of them do it at the exactly same time. So also in capsulorhexis, again, the image guided system, as I told earlier about the virion, that also, if you don't have a femtosecond and you have just a virion, then this virion, you can map it according to whatever size you want, 4.5, 5, 5.5 millimeters, and it will give you an overlay. So you will know exactly where you're supposed to be inside the guided marks where you can make your rexus. Just when we thought that image guided was enough and femtosecond was too expensive, in came into the market the Zepto cataract surgery that has been covered in the last talk as well. So how this works is that it has a 4 millisecond energy, very short energy pulse, and it uses a vacuum. So you're supposed to place it inside the eye. It is a little cumbersome. You do need an assistant to do it with you simultaneously. So when you place it inside the eye, that person has to have the vacuum ready. So it has to be a coordinated thing. So the only downside I would say to the Zepto, although it is extremely economical when you compare it to the femto technology, is that you need a very good assistant to be with you who does it at exactly the same time that you guide the person to do it, because it has an electrical impulse. The moment it reaches the capsule is the moment that the vacuum has to be released. Okay, so the new boy on the blocks is the capsule laser. It has not yet come in India. So all the other things that I mentioned before, you needed something that was a separate machine. For the femto, you need a huge machine. For the Zepto, again. Here we have a capsule laser which can actually be fitted on your microscope. And once it is fitted on the microscope, it takes 1/3 of a second in the capsule laser to actually make this rexus. And it is completely comparable to the one that is made on the femto. So it was introduced back in 2019 in the USA. And this is again making ground, and it will soon be available in the Indian market. Coming to the next step, that is the nucleus fragmentation. So we had the conventional cataract surgery in which you're supposed to either make a trench and then separate your cataract, make fragments of it, or do a direct job by embedding your tip. Then we moved on to the laser-assisted cataract surgery. That was the femtosecond. And just when we thought that the laser-assisted cataract surgery was enough, there came the MyLoop from Zeiss. So how does the MyLoop from Zeiss help? The MyLoop from Zeiss, you're supposed to basically take it around the nucleus. It has a lot of learning curve. It's a pen-like device. It has zero energy length fragmentation. That's where it helps. It's extremely helpful in hard cataracts. It has a full thickness length fragmentation at any grade of cataract is what the company claims. It's engineered to minimize capsular stress and phaco power that is done when we're doing a chopping. It uses micro-thin, super elastic and self-expanding nanotale filament technology. So this does have a learning curve, but once you master it, it becomes easy. So again, this is a Zeiss product. It's an expensive product. So what we also have in the market now.
Rohan, can you just conclude your talk?
Yes, I'll just conclude it. So what we also have is the phaco pre-choppers. Now these pre-choppers can be used. They're extremely economical. The intraocular lenses, we have the Alcon. We had the Panoptic since a long time. Now we also have the Toric that we were waiting for a long time. Now the AMO has come in with this thickness eye hands technology, which gives you distance vision and intermediate vision without any rings that are there. The problem with the rings is gone with this eye hands IOL. Coming to the last part of my talk, that is planning. I think that's the most important part in cataract surgery, and very important part is biometry. Precision and accuracy in biometry, and I'll tell you why. The reason is that claims relating to biometry errors and wrong intraocular lens power were the second most frequent causes of claims and results in payment of damages in 62% of closed cases in the UK. This has been published in the British Journal of Ophthalmology. So stressing upon your biometry, I mean, the more you stress, the less it is. So the swept source OCT is the latest kid on the blocks. Anterion, as we know, it's a single modal machine. It has the cataract, corneal, imaging as well as the metrics apps all in one machine. So eye trace, again, aberrometry. This has a new thing that is there. We already knew that the modular transfer function and point spread function was there. What this now has is something called a dysfunctional lens index. So what it tells you is it gives you aberrations separately, whether they're coming from the cornea or from the lens. So there was no machine till now that could give you whether the aberrations are coming from the cornea or the lens. That helps us in choosing when to go ahead with the cataract surgery. Now, hitting the target with the IOL, we've seen this chart everywhere that when to use what IOL formula. The latest formulas are the Olsen-C formula. We know this is according to the effective lens position. It takes into consideration something called a C constant. Then the Hill RBF formula, which is an AI-based formula. This has basically what it has done is that the SRK formula gave us a 0.5 diopter accuracy in 78% of the cases. Now with the Hill RBF and the Barrett Universal 2 formula, we have achieved a 91% accuracy of 0.5 diopter out within in our post-op cases. The Super LADAS formula again is a self-learning artificial intelligence formula that is also coming in to our markets now. And looking into the future is the Kane formula that is again just released about 6 to 8 months ago. This is another formula based on the AI platform. I'll conclude my talk saying that it is not the strongest of the species that survives, nor the most intelligent, but one that is the most responsive to change. These are the words of Charles Darwin. And evolution, as we can see due to the pandemic, how our ears are probably going to be coming out if we continue wearing these masks. Also, I'll take this opportunity to invite everybody to this talk that we're having tomorrow on the Youthful IRSI chapter. It's the Guru Mantra Smart Investment as an ophthalmologist. And this is our QR code. We can all take a screenshot of this and we can log in tomorrow. It's a monthly thing. So it's going to be happening every month. Thank you so much for the opportunity.
Thank you, Rohan, for that excellent talk. Can the panel please take some comments, give some comments?
Excellent talk, Rohan. You have covered almost everything which is there to be covered in newer advances. One more thing what I can we can add is that newer viscoelastics have come. The high density Helon, that is 1.8% sodium hyaluronate and 2.3% sodium hyaluronate, which we can use to make good rexis in hypermature cases, so that rexis now does not occur. And Viscoat is there from Alcon, and many Indian companies are also now making it, so conducting sulfate plus sodium hyaluronate to protect the endothelium in hard cataracts. That's it, and everything else is quite good.
Yes, I think I agree. We just had the Viscoat till now. Now that the Indian companies have jumped into this, it's become much more economical and affordable for us. That's a great point taken. The Indian company is making it.
Dr. Nandini, can you just say if you had, is femtosecond laser the way to go? Or are we getting back, to our normal phaco? Dr. Shibashish, can you take that question if Dr. Nandini is not there?
Yeah, good evening. Dr. Rohan, it was a wonderful talk from you. It has covered almost everything. Yeah, femtosecond, in my opinion, it is the way to go forward. 3D surgeries are coming up, but in other centers, the cost to benefit ratio, it is, I think it's still not working out. It's still not so popular because of the high cost, but I think it is the way forward as with femto. But I think the changes in the IOLs, the multifocals, the way the companies are coming up with to reduce the glare and the halos, I think the companies are more targeting on bringing up better quality multifocals, as some patients do complain of halos. So I think multifocals are a big area where cataract, it will take the post-op outcomes to a newer level.
Dr.
I think, Karan, to answer your question, I definitely think that femtosecond is the way forward. Cataract, as we all know, is the bread and butter for all ophthalmologists. And with femtosecond coming into place right now, it is the way to go, which will actually make the cataract surgery very easy for the next generation. If you see, and as Dr. Rohan has pointed out in his slides, all the steps actually become robotic. This is what the age is going towards on the robotic surgery. So we would just be sitting and doing the surgery with precision, because now cataract is becoming a refractive surgery where the patient actually wants a total correction with minimum of discomfort to the patient, which is there also the femtosecond and with the ingenuity where the illumination is very less. So it actually makes the surgery very comfortable both for the patient as well as the surgeon. And I'm sure it has a learning curve, but lesser than what we had in SICS.
One final question before we move on to the next session is, if you have to buy one machine, so many things, fancy things that Rohan has shown, just one word, what would you buy?
Zepto.
Femto.
Depending how much I have, so I would really want
Can't
to buy
afford
everything.
Femto at all.
Can't afford it, yes, but I hope that in future Femto becomes more affordable for all of us.
Dr. Das?
Yeah, I also feel if the femto becomes more affordable for all of us, that is the way forward. Or if I would have given the option, I would invest in a good phaco machine. That will work. I think a good phaco machine with a good fluid dynamics will take care of the other parts. If I have a budget crunch.
If phaco was one of the options, then phaco definitely.
So we'll wrap up this session now, and we'll move on to the next session. Avanish?
Yeah, thank you for this
Thank you.
exhaustive talk. I will come back to Retina here. We have the panel as Dr. Mohit Dogra. He's the assistant professor in Advanced Eye Center, PGI Chandigarh. Then we have Dr. Mayank Bansal. He's the consultant vitro retina at Fortis Memorial Research Institute, Gurgaon, and he's also a PhD scholar in genomics at CSIR Delhi. Then we have Dr. Kaustubh Harshi. He's the ex-consultant at Shankara Eye Hospital, Kanpur, and now he is the director and consultant at Daksh Netralaya, Jabalpur. Our speaker for today is Dr. Bhavik Panchal. He is the vitreoretina and uveitis specialist at LVPI Bhubaneswar. Over to you, Dr. Bhavik.
Yeah, just a correction. Visakhapatnam, Avnish.
Visakhapatnam. So sorry. Yeah,
you need
please.
to visit this place. It's a fantastic place here. Okay. So you'll never forget. Yeah. So yes, Karan, I'll stick to my time.
I'll show you that the team which began YOSI, or the founder members, were 10 people, and the
Is someone else speaking?
Bhavik, go ahead.
Okay, yeah. So I'll 6 minutes or 7 minutes to sum up the entire innovations in Retina, a difficult task. So I have taken certain liberties and showing the top innovations in the last 1 second. Yeah, in the last 5 years or so. Okay, so I'll be covering the talk in 3 basic aspects, that is imaging, medical retina, and surgical retina. So coming to imaging in retina, I'm going to divide into top 3 innovations, basically not going into the depths of it because this session does not warrant a detailed discussion of each of them. It will be maybe a 2-hour or 3-hour session then. So coming to number 3, WF and UWF. Okay, so to keep it simple, it's wide field and ultra wide field imaging. So how wide field and ultra wide field imaging has changed the way, So how this has made the life easier for ophthalmologists who do not have to struggle with the indirect ophthalmoscope finding a break. Look, here what we see is a retinal dialysis, and even a dialysis can be imaged now. Earlier it was difficult with just a fundus camera. Coming to OCT, wide field OCT, yes, it helps for peripheral regions, which is outside the arcade. The dream definitely is the montage which is put here by photographer John Golding, where he imaged the entire eyeball from the anterior segment and even the posterior segment as well. So if in the future, we are looking forward to this. Sticking to wide field imaging and coming to OCT angiography, a wide field opta helps us, and maybe it's a debatable issue whether fluorescent angiography can be replaced by it or not. But this is yet another tool for retina surgeon. Next is fluorescent angiography. So peripheral lesions which are missed out, and you can look out for tumors and vasopressors for tumors and a lot of other conditions which can be easily identified here. Number 2 on this list is pediatric retinal imaging. So I'm putting an entire box of pediatric retinal imaging, because that is what has changed in the past 5 years. It was very difficult to image the newborn kids, especially the premature kids, and with use of portable handheld cameras, wide-field cameras, and faster image acquisition. Like, we cannot ask an infant to just keep their eyes stable, right? They're going to keep on moving their eyes. So this is where the advantage of a faster image acquisition helps. So this is definitely a game changer for me. That is pediatric retinal imaging. And the top one is, so before we go to the top one, there's a bonus for all as well, and that is intraoperative OCT. So it's still new in the market. Again, yes, like the previous speaker mentioning about femtosecond, this is expensive and not yet in all centers, but this is definitely a future game changer where you can actually identify which layer you are in and which layer you want to inject a drug, which layer you want to remove the tissue for a sampling. All those things can be easily maneuvered with the help of an intraoperative OCT. Coming to the top innovation, which I feel which will be driving us in the future, is adaptive optics imaging, where if you look at the slit here, what you see in this, even a smaller amount of the resolution is so good that we can actually find out a difference between a spatial distance between the cones, the photoreceptor, the cones and the rods. So this is where the future lies, that is adaptive optics imaging. This was all about imaging. Coming to medical retina. So medical retina has many innovations which keep on happening every year, every 2 years. So again, the top 3 innovations for me will be, number 3 is the drug delivery system. So why I'm talking about drug delivery system is what we have right now is topical medication, intravitreal medications. But a newer drug delivery system, that is suprachoroidal route, has been explored, and it's still into use. People are still trying. As of now, steroids have been injected into the suprachoroidal route, which is working very well without any complications or side effects. So a special device has been made as well, the injectors for the suprachoroidal, to reach the suprachoroidal space. Another important component I want to see show here is the use of subcutaneous adalimumab. Why this is important, and again a game changer. I'm using the word game changer because it has a relevant meaning. All this monoclonal antibodies need to be given IV, for which patients have to be admitted. It's a very difficult task. The use of adalimumab into a subcutaneous route has made life easier for a lot of patients with uveitis. It's just like a Humira pen, which just like an insulin pen, you just need to inject subcutaneously. It's that simple now. Number 2 is the new anti-VEGFs. So no talk can go without mentioning of new anti-VEGFs. So we all know the hype around brolucizumab, that is Pagenex. Apart from that, few other in the pipeline are Convacept, again a Chinese product. So people, I'm not sure, the results are little equivocal. Faricimab and abicipar. So we're going to hear them a lot more in the next 5 years or so. And the top innovation for me in retina would be the port delivery system, that is implant based, especially ranibizumab. If this becomes possible and its efficacy works out and safety as well, there's nothing like that. We'll reduce number of patient visits to the hospital, number of injections. So the trials are going on. On similar lines, we have the brimonidine as well for geographic atrophy in dry AMD cases. Coming to the surgical retina, again a very vast topic. Sticking to the theme of top 3 innovations. Number 3 is endoscopic vitrectomy. In what you see on the right hand side image, you have certain corneas which are scarred or has a keratoprosthesis, and it's very difficult to go within and manage those cases if there's a retinal detachment, if there's infection. So this is one system which has changed the way a retina surgeon can approach such eyes. Number 2, here lies the future, that is hypersonic vitrectomy. Again, I'm saying future. I don't know efficacy wise whether it's good to the new system or it's the same, but definitely there is an innovation in the field of vitrectomy, that is hypersonic vitrectomy and hyper with dual blade. So two double bladed cutters and vitrectomy at the rates of millions per cuts per minute, where it just liquefies the vitreous and there is no limit on the absorption of fluid which comes in. So this is exciting times ahead for a retina surgeon. And finally, number 1, a 3D heads-up vitrectomy system, obviously brought in by Ingenuity, that is Alcon. So no financial interest here. Why this is important, or it's nothing great what we're doing, But if you look at the life of a surgeon, which or retina surgeon, where a lot of back muscle and neck muscles are used, and posture related issues, all these things can be easily ironed out. Cost is a factor here, yes. In terms of education as well, you can teach your residents, fellows on this system. So this is the way ahead for education, technology use in education, as well as from the ergonomic point of view as well. So that is from my side. Over to you, Avnish. I hope I was in time.
Yes, yes. Thank you so much, Dr. Bhavik. Coming to the panelists, Dr. Mohit and Dr. Mayank and Dr. Kaustubh, your feedbacks on this particular talk, please. And then I'll ask some questions.
I think Bhavik, great talk, very succinctly put together, extremely difficult topic. I'm just going to, try and play devil's advocate and talk about maybe 3 different things, which I'm pretty sure you had in your mind, but couldn't put in because of the lack of time. So I think one thing which is not just around the corner, but there on the anvil and actually available for our colleagues in Europe is actually the availability of robotic VR surgery with Dr. Mark T. Smith actually, leading the way, with Precise being the name of, his company. And there are actually 4 different robotic arms which are now commercially available in a lot of centers. And you can actually buy it off the shelf, if I can use that term, in Europe. So you can, and they can do stuff from, peeling to segmentation to excision to removal to cannulation of arteries and veins and, stuff like that. So I think that is something which is not just, I as a retina specialist take pride in that fact that, retina being the toughest thing, I think, to robotize, if I can use it. But they've actually gotten robotics into that. Also, I'm not going to talk about gene therapy. I think Mayank is, much better suited to, talk about that. Another thing that I think we must, keep in mind is that not just with the Ingenuity, which you talked about, but we also have the Artivo 800, which was actually launched primarily for anterior segment, but is now being used for the posterior segment also. And Dr. Anat has done a lot of work with the, so to completely eliminate the screen, if you can just have like a helmet and, akin to augmented reality and virtual reality video games that people tend to play nowadays. So that's something that's actually not commercially available as yet, but the Israelis under Dr. Anat have done a lot of work. And again, exciting times, looking forward to, getting our hands on those in the near future. Thank you.
Well, yeah, excellent talk, Bhavik. Really covered everything, a lot of things within those minutes. Taking from where Dr. Mohit left, yeah, I think just adding on the retina aspect, gene therapy and stem cell related use, both for our degenerations and dystrophies in the retina are showing more and more promise. Genomic editing using CRISPR, which won the Nobel Prize in Chemistry this year, has reached clinical trials, which is the BRILLIANT study. And it's been used for the CEP290 gene therapy, genomic editing. Apart from that, of course, Luxturna, Voretigene, Oparonac, the use of that and how it's been able to, show better visual gains with the ML, multi-luminance mobility testing, MLMT. And apart from that, use of stem cells. So iPSCs, while initially there was a lot of emphasis on human embryonic stem cells, which were differentiated into RP and then injected, but a lot of ethical concerns around that. Now with iPSCs, especially autologous iPSCs, HLA matched ones are being now tried to be injected in patients with dry AMD, geographic atrophy, largely led by the Japanese group, Takahashi. Takahashi's group in Japan, and they've been doing HLA typing and then injecting these cells. So to some extent, they are showing some degree of promise. The concern or the reservation largely remains around the integration of the cells over a long period of time. But I think molecular biology in that front is holding a lot of promise from retina treatment point of view.
Nice talk, Bhavik. I think most of it was summed up by you. And I wanted to add, I was going to talk about RTO 800 and Dr. Mohit added it rightly. I think the RTO 800 is also allowing intraoperative OCT platform on the 3D heads-up viewing. And in addition to that, you guys have done some work on fibrin glue and its application in retinal detachment surgery. And one more important thing is like because I am set in private practice, I always keep a watch on the smaller innovations being made, and a lot of these were shared in our late night retina sessions, where like the use of Excel sponge for doing vitrectomy, the use of suprachoroidal visco as a buckling agent, the illuminated indenter, the lot of handheld devices coming up for retinal imaging, smartphone-based imaging, and even recently what Dr. Divyansh had shared about using the 90D or the 78D lens to image a wider angle of OCT on the swept source machine. So I think we need to keep a track on these smaller innovations made by our indigenous people, and I think it will go a long way in a retina practice in our country.
Thank you, Dr. Kaustubh. Just one quick question to Dr. Kaustubh. Would you prefer a wide-angle imaging, or would you go for a Nocta since you're doing a private practice? Just one line, that's it, and then we'll move on to the next.
I don't have either.
Okay. Thank you so much.
I'm good with conventional fundus photo as of now.
So it's a very interesting question. I would like to go for wide angle imaging or Octa, if you want to invest into it.
Yeah,
I would go for wide angle imaging probably.
Yeah, that's I think the right decision.
Okay, thank you so much. Over to you, Dr. Karan. We'll start the next. Thank you so much, the panel.
Thank you for that excellent discussion and talks. The next session would be oculoplasty. I'll introduce the panel. We have Dr. Sahil Agarwal, who is a senior resident in oculoplasty, ocular oncology, and pediatric ophthalmology at RP Center AIMS. Dr. Puneet Jain, who is also a product of RP Center AIMS and a student of Dr. Santosh Hanawar. He is currently working at IQ Super Specialty Hospitals and Max Healthcare New Delhi. Dr. Nupur Goyal, who is also a product of Ali Prasad Eye Institute, Hyderabad, and is currently practicing in Mumbai. The speaker today is Dr. Rituja Thomas Grover, who is an oculoplastics and oculofacial aesthetics consultant, trained at Narayan Netralaya, Bangalore, and is practicing currently at Vision Eye Center, New Delhi. Over to you.
Good evening, everyone. And today I'll just be talking about what's happened in oculoplasty in the past year. So definitely compared to all the other specialties, oculoplasty does have a sort of higher risk for COVID-19, primarily because we end up dealing with the nasal mucosa for multiple procedures. So this particular study, which or rather paper, which came about early during the lockdown, mainly dealt with preoperative screening and use of PPEs and really classifying how important certain orbital surgeries are, as most of them are actually elective surgeries. But most importantly for lacrimal surgeries, initially there was talk of fluorescein dye disappearance test sort of replacing syringing, but a surgical decision cannot be made on an FDDT. So it was decided finally that irrigation or lacrimal syringing should be done using a PPE, and that would be a better way of going about planning a DCR. Endoscopy, definitely, as Dr. Javed has also come up with, that before planning an endoscopy or any such nasal procedure, definitely irrigate the tissues with 0.4% povidone iodine. And definitely for the oral mucosa as well, we have started telling patients to do povidone gargles. So that again is very important. Extubating, that is removing the tubes after lacrimal surgery, is not really an emergency. Only if there is sort of a risk or any granuloma has developed or something like that. In that case, you need to definitely go ahead and do it, but again with a PPE. And of course, they've sort of told us about how important various procedures such as probing DCR and DCT are, and we know that DCT is the safer option. Very importantly, later on in the lockdown, the oculoplasty residents abroad, that is in America, they sort of picked up information about how their education was doing. So all of them definitely continued to practice in participate in surgical procedures which were deemed as emergencies. But many of them did feel that their surgical confidence declined. So this is something which would be interesting to discuss towards the end. And definitely a surge of orbital mucormycosis, and rhino-orbital involving the nasal cavity sinuses as well. So I know for a fact that in RPC and in Gangaram Hospital, there are multiple cases seen every day, which is usually not the case. So this is definitely something which is worrisome because the COVID-19 infection definitely immunocompromises people. And definitely to improve survival, that is life, exenteration is one of the main state treatments. And also patients who had a FES surgery along with an ENT surgeon also did well. Coming to one of the most difficult things to treat, that is active thyroid eye disease, a lot of new drugs have come about other than our traditional intravenous methylprednisolone. So rituximab definitely, but it's not really shown such great results. Tocilizumab, recently available in India, has shown some efficacy. But the hot topic now is about teprotumumab. So it's an insulin-like growth factor receptor inhibitor. So it has shown definite efficacy in a phase 3 trial, which concluded early this year. So now teprotumumab has been shown to show a proper response. That is 83% of patients who received teprotumumab every 3 weeks for 24 weeks showed a proptosis response, that is more than or equal to 2 millimeters of reduction in proptosis as compared to 10% improvement in those who received a placebo. Teprotumumab, however, does come with its limitations of you can't use it in patients who've received steroid earlier. You cannot use it in patients who have sight-threatening disease. So definitely a lot of things come into play, but I would say the most limiting factor is the fact that it costs around $15,000 per vial. So that's around 11 lakhs, so which is a big thing for us. Some cheaper treatments. So triamcinolone injection into the fornix has been shown to be effective to reduce lid retraction as well as the clinical activity score significantly. So this is definitely useful. And with respect to surgery for thyroid eye disease, there are many classical routes very nicely displayed in this book by Dr. Millen. But nowadays, navigation surgery definitely has been shown to improve strabismus outcomes and also decrease surgical time. So especially while removing bone in the medial wall, instead of removing a lot of it, you can just remove a specific area so that the medial rectus can prolapse through that area and reduce proptosis. So definitely individualized. And navigational surgery, the scope has been sort of expanded to not only decompression but fracture treatments, removing intraorbital tumors, decompressing the optic canal. So all of this is definitely new, and definitely it does enhance the precision of a surgery. The limiting factor again is cost with respect to the navigation system. And the learning curve, however, is controversial. So in this review article, which came about last year, it is concluded that the learning curve is a little more. However, in this study by Zavatero et al., they found that actually after a few cases, the senior surgeons and the junior surgeons had almost comparable results. So there is an exciting prospect that navigation surgery might even become something to train with. So that's exciting for the future. And not only 3D printing processes being used for orbital fractures. In LVP, they've used the 3D printing to sort of rehabilitate migrated orbital implants. So that's also something new and nice. So other than orbital fracture repair, you can also use it instead of a dermis fat graft because as we know, the graft necrosis rates are high. So this is nice. And recently, topical timolol was found to be extremely effective for pyogenic granulomas, with only one patient out of 12 needing surgical excision. So using it for 4 weeks and seeing results is quite nice, especially in children, although in children, in the 2 children that were in this study, the IOP was not studied. So, but it does seem to have some promise. And another little drop, which is found to be useful for very mild ptosis, that is ptosis in which if you operate, you cannot guarantee that it will not be overcorrected or undercorrected. So it gives almost a 1 mm correction. So on day 14, when used once a day, it can give a 1 mm correction, which is something new. And the lymphatic malformations, they have multiple modes of treatment, but of late, bleomycin is being used for a lot of these. So 23 gauge syringe is inserted, the fluid is removed from the lymphatic malformation, and you inject bleomycin. So around 0.5 mg per kg, not exceeding 10 to 15 units of bleomycin is injected. And this gives good results with around 3 to 4 injections given serially. It does come with its side effects, that is erythema, swelling, pain, etc., but it can be managed with oral steroids. Something to look forward to, which hasn't happened yet, is this systematic review on transconjunctival approach for orbital fractures. So it'll be exciting to know how good the transconjunctival approach really is. So that's nice. Thank you very much.
Thank you so much,
Thank
Dr.
you, Ritija. I would request the panel to take a discussion forward.
Thank you, Dr. Ritija. It was a great, quick and sweet update on plasty. So yes, we at RPCC had quite a good number of rhino-orbital and rhino-orbital cerebral mucormycosis, which are referred from the neurology for consultations. But as you said that during the COVID times, there has been an increase in the same, as the patients probably must have not been able to follow up for the underlying conditions of the immunocompromised state they already had, and also with the late presentations. So we had more referrals from the neurology rather than direct presentations to our casualty. So I'll just add something to the management, that irrigation and packing of the involved orbit and perennial sciences with amphotericin B have also seemed to have achieved a quite good result. The same can also be tried with the use of radiopaque silicone catheters that allows the surgeon to radiologically confirm the ideal catheter placement from the intraorbital drug. Posaconazole has also been used alongside with liposomal amphotericin, not as a primary therapy, but in those with patients with refractive mycosis and those who are intolerant to amphotericin B, as we very well know that amphotericin B causes a lot of nephrotoxicity. And as these patients are generally immunocompromised, some multiple immune augmentation strategies like GM-CSF, G-CSF, and interferon gamma can be used. Thank you. Dr. Nupur, would you like to add something on TED?
So TED, with respect to what Ritija showed about teprotumumab, is it's quite exciting, but classically I am a more conservative kind of managing TED. I generally do not give steroids. My indication for it is a sight-threatening disease. So in that, if it is contraindicated, so we'll have to wait for what it brings as promise. Yes, with respect to the injection that you spoke about, triamcinolone, again, so I believe that would work if it's in the typical active stage of the disease. If not, at least clinically active, the timeline-wise activity. So again, personally, I wait for the timeline activity to settle before really going on to treat anything like an eyelid retraction or something. But yes, I mean, that could be, I think it can be offered to the patient and the results are good to be seen. So yeah, that's it. And yeah. So Dr. Sahil, would you want to comment anything on the fellowship that's, on the upcoming fellowship era, how it's going to, especially with respect to plasty and yeah.
Yeah, the resident training during this COVID-19 has been hampered in all the fields of, in all the various aspects, various fields of ophthalmology, but just that what extra we have done at our center is that on both sides, apart from not just speaking of plastic, we have tried some bucklings, recessions, and sections for squint surgery, some glaucoma surgeries, and corneal perforation repairs. Another study from LVPI where they have created a model based for DCR, It was a good study. Provided the person had also shown a similar study at the previous YOSI meet. So apart from that, yeah, restoration of various aesthetic procedures and hands-on will take time, but yeah, definitely over the next few months, once the vaccines are in the market, we'll start off with them. Till then, what the juniors and residents can basically primarily focus is on the oncology cases and the reconstruction, as they already as we already seen them, the traumas and various infectious patients present in the oculoplastic clinics.
Great. Also, Rutuja, you have very nicely compiled all the recent advances. Also, that the article on timolol in pyogenic granuloma, that was also a very good. So that again, something which we can all try, and it's really nice.
Yeah.
And yes. Anything else, Dr. Sahil, you would like to chip in? I'm sorry, Dr. Puneet could not. Yeah, Dr. Puneet
I
could
think
not
we'll
join
move
us.
forward now.
Yeah.
Dr. Puneet is next. So we'll move forward
He
now.
could not join,
The next
Karan.
session-
Yeah.
Yeah, so we missed you, Puneet. So we'll move forward to the next session.
Great.
It's on glaucoma, and it's my pleasure to introduce the panel, Dr. Rajat Mohan Srivastav, who is the faculty and glaucoma co-in charge of the King George Medical University in Lucknow. Dr. Jyoti Shakrawal, who did an MD and senior residency from RP Center, AIMS, and is currently working as an assistant professor at AIMS, Jodhpur. Dr. Shikha Gupta, who's also did an MD from AIMS and is currently assistant professor glaucoma services at the same institute. Dr. Shivani Dikshit, who's a very good friend of mine, and she did a glaucoma fellowship from Narayan Netralaya and is an ex-consultant of Sitapur Eye Hospital and is currently working as a glaucoma consultant in SRJ Netralaya, Indore. Over. Dr. Shivani, you can start presenting.
Yeah, thank you for the introduction, Dr. Karan. I had forgotten to unmute myself. I'll just share my screen. Yeah, so at the outset, I would like to thank YOSI to give me this opportunity. Let's talk about what's new in glaucoma. For the diagnostics, I will discuss virtual perimetry and OCT angiography. There is an upcoming class, Rho kinase inhibitors for the medical management. And under surgical management, I will be speaking about endoscopic cyclophotocoagulation and a bit on MIGS. So we know that standard automated perimetry remains the standard technique for detecting visual pathway dysfunction in glaucoma. However, these perimeters are stationary devices and they are difficult to be performed by bedridden patients or the ones with cervical spondylosis. Now, virtual perimeter is a head-mounted perimeter with a better flexibility in performing the tests. And the various virtual perimeters available are virtual eye, IMO, C3 field analyzer. I will be speaking about IMO. Here, the optical system can measure the visual field within 35 degrees from the fovea. And as we can see in the right image, there is a head-mounted perimeter. Then there is a user control tablet, and there is a patient response button. So this presents test target randomly to each eye with no awareness by the examinee as to which eye is being tested. It uses a modified ZEST algorithm called ambient interactive ZEST. So basically there are studies mentioning that this algorithm reduces the test performance time by around 70% as compared to the conventional 4:2 decibel bracketing system. The test programs offered are 30-2, 10-2, and 24-2, just like Humphreys. The mean deviation and pattern standard deviation here are derived just like Humphreys. So actually, we don't need any special skills to interpret these test reports. C3 field analyzer, here the Vellore Institute of Technology and Arvind Eye Hospital have participated in the validation of this perimeter. The strategies here provided are the CFA supra threshold and CFA fast threshold strategies, with the test patterns being 10-2 and 24-2. Talking about OCT angiography, now this is an interesting modality. It scans the same region multiple times and uses the variation in OCT signal caused by moving particles, that is RBCs, to identify the blood vessels. The OCT scanning regions that we get here are the nerve head, the optic nerve head slab, the radial peripapillary capillary slab, and a deeper slab which shows about choroidal perfusion. Now we have evidences that OCT angiography can detect reduction in the density of superficial vessels in glaucoma. Just to explain what I'm saying, in the left, this is a fundus photograph showing a nice wedge RNFL defect, and corresponding to it on the right, there is a OCT angiography report showing lesser vessel density in that same region. We have various articles supporting this fact. Now, comparing its diagnostic ability with OCT, Dr. Harsha Rao has done some extensive work on OCT angiography in glaucoma. He has a couple of articles which conclude that so far OCTA is not superior to OCT measurements in the diagnosis of POEG and PACG, but it is an upcoming technology. It needs to evolve further before it becomes a part of glaucoma workup in our clinics regularly. Speaking about Rho kinase inhibitors, so Rho kinase participates in modulating the cell shape and size by making changes in the cytoskeleton. The Rho kinase inhibitor agents available are Repasudil and Netarcudil. Talking about their mechanism of action, they basically increase the trabecular outflow by increasing the cell permeability, increasing cell relaxation. They also seem to have some neuroprotective role. By increasing the blood flow to optic nerve head, they seem to increase the retinal ganglion cell survival. In rabbit eyes, Rho kinase inhibitors have shown to decrease fibrosis in eyes post-trabeculectomy. The agents available in market are Repasudil 0.4%, Netarcudil 0.02%, and there's a combination of latanoprost with Netarcudil which comes by the name of Rocklet. This chart of adverse effects of Rho kinase inhibitors has been taken from the Mercury trial, and as I've highlighted here, conjunctival hyperemia is very common with Rho kinase inhibitors. They do have some additional benefits. They have shown to facilitate corneal endothelium wound healing, and so they are being tried for diffuse endothelial dystrophy in cornea. Talking about the drawbacks, now these agents seem to be more beneficial for glaucomas where the site of damage, the primary site of damage is trabecular meshwork. So they might not be very effective in angle closure glaucomas. And as they have vasodilatation properties, they cause conjunctival hyperemia more. Speaking about endoscopic cyclophotocoagulation, ECP. Now this is a cyclodestructive procedure, but here we can directly visualize the ciliary epithelium, thereby allowing the laser energy to be precisely delivered to the ciliary process. So it limits the damage to underlying ciliary body and the surrounding tissue. Here a laser endoscope is used, which contains fiber groupings. There is an image guide, there's a light source, and there is a diode laser. Now, these ciliary processes can be accessed via a limbal approach or a pars plana approach. Limbal approach is performed, or it's preferred in patients who undergo ECP combined with cataract surgery and IOL implantation. Usually 270 to 360 degrees of ciliary processes are treated. And what's the end point? This laser is applied till there is shrinkage and whitening of the tissue. Lastly, speaking about minimally invasive glaucoma surgery, MIGS, we know that this approach preserves the conjunctiva from surgical dissection. So it saves conjunctiva and sclera for future surgical interventions in later course of the disease. Here, the approach is via an ab interno incision, which is a clear corneal incision. And MIGS is currently being targeted at patients who have mild to moderate glaucoma. Narrowing it down to the procedures where we are able to bypass the trabecular meshwork, it can be done by an ab interno trabeculectomy using a trabectome, or goniotomy, or a gonioscopy assisted transilluminal trabeculotomy GAT procedure, which is the one I will be briefing about. So this technique was described by Dr. Grover et al. It is a cost-effective mixed technique where the trabecular meshwork is circumferentially bypassed via a catheter, or to even make it more cost-effective by a polypropylene suture. So this technique basically allows the aqueous humor to be shunted into the collector channels and then out to the episcleral veins via the cleaved open trabecular meshwork. It goes without saying that here the consultant has to be comfortable and confident about holding the gonioprism during the procedure. A clear corneal incision is made and the anterior chamber is filled with an OVT. We use an MVR blade to create a 1 to 2 mm goniotomy incision at the level of the trabecular meshwork to gain access into the Schrem's canal. Then a 6-0 polypropylene suture is taken and its one end is just made a little blunt with gentle cautery and it is introduced into the Schrem's canal. And then this is advanced circumferentially 360 degree. Then we just make the distal end stable and pull the proximal part just to cleave the trabecular meshwork. A study by Dr. Grover et al. On GAT with a long follow-up of about 2 years on open-angle glaucomas concluded that GAT is relatively safe and effective in treating various forms of open-angle glaucomas. So here I conclude my talk. Thank you everyone for the patient listening.
Thank you, Shivani, for the wonderful talk. Panel, please go ahead.
Yeah, thank you, Dr. Shivani, for a nice talk, which is covering almost all the new advances which have been seen in the recent past. In perimetry, there have been also, I think we can talk about the advances which we are trying to make in assessing functions, visual functions in children. So perimetry in children is another thing which is now coming up, especially in young children, where we are trying to see the fixation patterns in those children to different stimuli to see what is the field of vision in these children. So those things are again coming up when we are assessing for perimetry. And yes, the virtual perimetry is now, I think, going to the way for this convenience and the kind of result it is giving. Also, we are also incorporating a pupillometry, which is a more objective response which we are seeing along with the virtual perimeter. That is that we see a pupillary response to infrared rays which we give. So that will make the responses more objective and will not only be the subjective responses of the patients. Now, yes, minimally invasive glaucoma surgery. I think Dr. Shikha ma'am has done some work on synechiolisis, goniosynechiolisis, especially in the patient presenting with angle closure glaucoma. So, ma'am, would you like to share your results on what we have got in here?
Yeah, thank you, Rajat. It was a wonderful talk. However, there are certain things that I would like to highlight. At RP Center in the perimetry, we have done iPad-based perimetry, which is the Moorfield this formula. And through this, we have found that we just need an iPad for the perimetry, not even the virtual reality-based goggles. And that has proven the testing time is shorter, and therefore it's very useful in children, pediatric population, the children with glaucoma. And validity has been done. The results are similar, and it corroborates with the HVF perimetry. So that is very useful, and especially for the private practitioners who are today there at the YOSI forum, it is very cost effective compared to a HFA or even the virtual reality perimetry that has been talked about, and can be easily adapted in any private practice clinic. Also, in the OCT angiography, what is coming these days around the world is the aqueous angiography that I am also looking forward to working on. And this is for the aqueous outflow channels. In this, fluorescein dye or the ICG dye is injected, and we can actually see real time the aqueous outflow channels and actually detect where the obstruction could be. And based on that, we can offer treatment, especially could be important in the glaucoma patient's eyes. And other thing is in trabeculotomy, we have been doing goniotomies with phacoemulsification in adult glaucomas also, and it has almost become a part of our standard approach, especially for those patients who have cataract and are on borderline pressure control. And we offer them phacoemulsification with goniotomy, and later, if needed, it reduces the number of medications for them. It can control the IOP completely for them. And later, if needed, we can do a more invasive procedure like trabeculectomy for these patients. MIGS has, the advent of MIGS has shown a lot of ups and downs in terms of various devices that I've seen. But now the trend all over the world is that the stents are not so useful, whether it is eye stent or the suprachoroidal stents, and the ab internal trabeculotomy or goniotomy is the way to go forward. And there are various innovations within that also. There are retractable devices which through an injector, we can inject the proline suture and it crosses the entire Schlemm's canal and just ruptures the Schlemm's canal, unlike manually, which is done in GAT. Other than that, there was also, I wanted to talk about KDB goniotomy, which has a lot of promise, though the blade is not yet available in India, but it has shown results better than the trabectome. That is a very cost, you have to invest a lot of cost in that. Among the drugs, the newer drugs, I would like to say that we are already using the Ropressa, that is the marketed by the name of Natalo, that is Netacidil, that is Rho kinase inhibitor with NET transporter inhibitor. So it is very, very effective and does cause conjunctival hyperemia, but less than that of Ripatec, which is the only Rho kinase inhibitor. But we are still looking forward to latanoprostene Bunod, which is still more efficacious. So it can actually replace latanoprost or the prostaglandin analogs in such cases. So these are the ways that we are looking forward. And Jyoti, any comments from you?
Thank you, ma'am. I would like to add about the OCTA, my experience in OCT angiography. In addition to the detection of the pre-parametric glaucoma, we have the advantage of OCTA in the patients with unilateral visual field defect in the eye, which is not having visual field defect on Humphrey's HVF. So we can compare the OCTA parameters of the defected eye with the fellow eye and the control. So we have found a significant difference in the eyes. So OCTA can be used as a biomarker for the upcoming early glaucomatous visual field damage. And in medical management, you have covered Rho kinase inhibitors. Apart from that, we have our drug delivery systems like bematoprost implants, intracameral implants we have corneal rings, bematoprost rings, and punctal plugs using travoprost. And in imaging visual field, you have covered. We have iPad visual field imaging systems, also MRF and visual field easy.
Yeah, just to add on to what Dr. Jyoti said, actually, because of time constraint, I couldn't add the one about the OCT angiography picking up defects in the blood vessel density before they come up in perimetry. We have done the similar study at Narayana and we have presented it at various platforms as well. So yeah, definitely it may help us in picking up glaucoma in the pre-perimetric stages. Yeah.
The drug delivery systems as of now are not yet available in India, and that would be sustained drug release is what everybody is looking for. That could be a game changer in itself. But as of now, we don't have it. None of these.
So thank you everyone. I would like to thank Dr. session, and we'll have to conclude now because it's time to start the next session. It was a very amazing session from all the speakers, the panel as well, and going forward to the next session, that is YOSI Global Oculoplasty. Thank you.
Okay, thank you.
A very good evening to the YOSI Global Oculoplasty. It's a proud privilege for myself and Dr. Apurva Ayachit today to start this session by introducing the young ophthalmologists, trailblazers of the world, as they relate an anecdote each from their life, either as a young ophthalmologist or as a YO leader. Now, storytelling is among the oldest forms of communication. The stories that we live, the stories that we share with each other provide coherence, meaning, and they orient our sense of purpose in life. Sharing of experiences will also bring us closer to each other. I'm very happy to share that Dr. Divakant Mishra has made humongous efforts to bring a star-studded panel today from both established and fledgling YO societies from all over the world. And I believe today's session, via means of anecdotes and later the leadership stories, will stimulate, amaze, and inspire potential young ophthalmologist leaders. I request Dr. Apurva to start this session.
Thanks, Sonal, for that wonderful introduction. So, like she already said, we are going to share anecdotes today, and by all the YO trailblazers of the world, these amazing YO leaders that we have. So an anecdote can be amusing or entertaining. It could be a running joke in your professional circles. It could be a personal story about a patient, no revealing identifiers, of course. A life lesson from a seemingly minor situation. A case that was interesting, not just in clinical scenarios, non-clinical ways. And lastly, anything that is witty, inspiring, or even poignant. So I'm looking forward to hearing anecdotes from all of you. So I hope you like this idea, and I hope everybody will enjoy this session. So I'll just start by beginning to share my screen. First, we have Dr. Ashraf Ul Haq, who is the founding president of Bangladesh YO Society. Ashraf?
Hello, everyone. Am I audible?
Yes, you are.
Yeah. Thank you, my dear YOSI friends, for inviting me here. And I'm very much honored to join with this group. So, I shall start my talk.
Yes, please.
Okay. So, in this forum, I would like to take the privilege to share the story of the Bangladesh Young Ophthalmologist Society. So what's happening that our society, which we formed just 4 months back, but the thing when in January 2020, we didn't have any idea or any plan to form a society. But this COVID era has given us the opportunity to communicate with the global leaders, global YO society leaders. So that give us the idea that, okay, fine, we should do something for our ophthalmologists, our young ophthalmologists. So why not forming the Young Ophthalmology Society of Bangladesh? And then we approached our senior for these YO societies, and we formed it in 2020, September 17th. I believe this is the newest Young Ophthalmology Society in the world, one of the newest. But you know that when you form a society, when you organize this thing, this is the experience which I want to share, that young ophthalmologists, being the young, they are very emotional rather than rational. And nearby, you have all the people who will criticize. But the good part is that this criticism, you can make it as a fuel for your speed of work, and emotion that you can have converted to the strength by your work. So we always believe that your work will say for you, don't talk, but your word, that will say for you. And in this 4 month, we have organized few international webinars, and we have collaborated with two Young Ophthalmology Society, and I'm very much grateful for the help of Yoshi. And also we have collaborated with the Philippine Young Ophthalmology Society. And in this 4 month, what happened is that, you know, in Bangladesh, we have around 1,000 ophthalmologists, and among them, like 180 are the young, because we have some age bar of 40 years. So among this 180, 2/3 of the ophthalmologists are now in our group in Bangladesh Young Ophthalmology Society. And we have some plan that what we learned from our mentors, that always try to give the best vision for the patient. 6/6 is the vision, but sometimes we can achieve 6/12 or 6/18 vision. That is the best for that patient. So simultaneously for the young ophthalmologist, try out the best from them. That is our goal. And hopefully in this COVID era, we are working, and every situation has given us the opportunity to do something differently. We are working for that. And I'm very much grateful for the Yoshi friends for giving us the opportunity. And you know, from the very beginning of this organization, Yoshi has helped us. And thank you, everyone. And the thing is that this is the virtual world that brings us together. But hopefully after the pandemic, we can have a meeting in the real world. Thank you.
Very wise words, Ashraf Ul Haq, and
Thank you
so much. And yes, so your work should speak for you. That is the take-home message. Thank you so much. Next, without further ado, let me call Chai Tanlapko from the Philippines Network of Young Ophthalmologists. Chai, the stage is yours. You need to unmute yourself, Chai. I hope I'm pronouncing your name right.
Oh yeah, there. Okay, I think I'm on.
Yes.
Okay, so yeah. But it's my turn now. Okay, because it's still Ashraf's there. Okay. Is there someone calling? Okay. Yeah. So the quote "never waste a good crisis" pretty much sums up my life as a YO leader in the middle of a pandemic. So like some women here, I am a wife, a mother to 2 toddlers. 6 years into my practice, I'm situated about 4 hours away from the capital of the country. And then my life was quiet until I got a call that I was the Philippine Young Ophthalmologist representative to the Asia Pacific Academy of Ophthalmology. So it's a newly created position tasked to finally cement the presence of YOs in our country, because we never really had a YO group. And then suddenly after that call, I realized it was no longer just about me anymore. It was already about us, the Filipino young ophthalmologists. So as a YO leader, I was probably born into this opportunity, but I feel that it is already in my hands to make it meaningful. So I like to think that Filipinos in general, so that includes the Filipino YOs, work smart, hard, and efficiently. But we are relatively shy, so we don't really assert ourselves. And most of the time, we only speak when we're asked. So it's probably why we don't see a lot of Filipino YOs in the international scene. But thanks to the YO societies of our neighbors like India, Taiwan, Korea, Singapore, Indonesia, they have become the evidence of what we needed to see what is possible for us. Our YO community, the Philippine Network of Young Ophthalmologists, is just 6 months old. We are focused on powering connections among us, as well as mentorship, networking, and other things formal training doesn't teach. We'd like to do projects that are inspiring, and we'll make sure that the practices of our young ophthalmologists will thrive wherever their fate will take them. We know that our group is still a lot of steps away from its peak, and a lot of work has to be done. But if we don't work, we know we won't get there. So just like many of the YO leaders here, I think we have the shared goal of breaking barriers and creating new frontiers. As for me, my goal as a YO leader is to open doors for Filipino YOs and to make sure these doors are kept open for them so that we can all be better ophthalmologists for our countrymen. I am confident that all the YOs in my country are ready for this and that we are ready to share what we have to the global YO community. So thank you, Dr. Divakant, and to the Young Ophthalmology Society of India for giving me the platform to give you an anecdote about me and the Philippine Network of Young Ophthalmologists, or Pinoy. There. Thank you.
Thank you, Chai. It's an honor to invite our next speaker, Dr. Premila Devi, who's a general ophthalmologist and vitreoretinal fellow in Malaysia. She is the committee member of the Young Ophthalmology Interest Group in the Malaysian Society of Ophthalmology. Welcome, Dr. Premila.
Hello, everyone. Can you hear me?
Yes.
Yes, okay. First, I would like to thank the YOSI for this opportunity, and also my colleague, Sudha Chandran, which is the president of the YO. She couldn't make it to this session today because she had some other engagement, but nevertheless, I'm very grateful for this opportunity. What I'm going to share is actually about my life journey from this start of the year, which has been something very unpredictable, actually. So it's very different from what everyone has shared before this. So we are back to full MCO here in Malaysia, and this has affected me as a trainee and also as a general ophthalmologist here. There is a lot of restrictions happening, a lot of roadblocks, and so we had to cancel OTs. We had to reschedule our patients' appointments, and just beginning of this year, I got shouted by a patient in public for rescheduling his diabetic vitrectomy for about 5 times already. And on top of that, I've been called to a new training center next week in middle of this MCO, this lockdown. That's about 10 hours journey from here by road. And I have to make this journey all by myself without any help from anyone because of the lockdown that I'm facing. Now, to add on to this complication, we're currently facing the East Coast monsoon here. So the state above and below me is completely flooded into many districts, and we're expecting the water to flow in at any time. And ironically, the first place that is going to be affected here is the hospital. So on top of that, we have to relocate all our equipments, our patients to a higher ground. And that's going on. And just to add spice to the drama that's been going on, just 3 days ago, the VR team, including myself and my consultants, were called in to review a patient that was seen by another consultant the day before, diagnosed as phacolytic glaucoma, but he couldn't rule out endogenous endophthalmitis. So they asked us to have a look. We look at the patient the next day. All the VR team looked at the patient, and we thought it was, the patient was responding well to topical steroid challenge, so we thought it was not endogenous endophthalmitis, but we still had to review the investigations taken to rule out any source of infection, and one of the investigations was the chest X-ray. Dr. Apurva, can I have the image of the X-ray, please?
You said you get the image yourself. I have put this.
How do I do that? Sorry.
Share your screen. Yeah.
Okay. So can everyone see that? It's probably not very clear. So I would not have flinched at any point of time, but I had to flinch on that day looking at that chest X-ray, because when any point of other times, it could have just been an interstitial lung disease with cardiomegaly and congestive heart failure. But at this point of time, COVID-19 was the #1 diagnosis we have to rule out. So every one of us were in tremendous fear, because despite wearing masks, we were not wearing a full PPE, all of us. So we had to be quarantined. The entire VR team was quarantined while waiting for the patient's PCR. And the agony that I felt through that quarantine was unimaginable. So the PCR thankfully came back as a negative, and the repeat PCR just this morning came back as negative. And despite all these things that is happening, what I would like to share is life has become very, very unpredictable. It's no longer about being a leader, just a leader, or planning ahead of how to be a best doctor or how to be a best surgeon. It's all about living life every day. It's about survival. It's about being human. And just because we are doctors, we are often viewed as leaders to many different societies, but we are also human beings, and we are vulnerable to many situations and emotions. So the key take-home message here is that there is no planning anything. We have to see positivity in each day, live one day at a time, make use of that day to help people around you, not just as a doctor, but also as a person helping, your neighbors do groceries, or, just fetching some medication for your family and friends, and keeping close touch with your friends. And hopefully all of us can get away and, from this endangering pandemic. Thank you.
So the only thing that stays constant is perhaps change, and a true leader is one who can have the potential to, adapt to all changes that come in one's path. Very well said. And now I would like to maybe move on to the next speaker. It's a very happy time to invite Dr. Sanushka, who's the current chair of the Ophthalmological Society of South Africa Young Ophthalmologist. She's an ophthalmologist in full-time private practice at the Pretoria Eye Institute in Pretoria, South Africa. Welcome, Dr. Sanushka.
Hi, everybody. Thank you to Yosi and Divakant for the invitation to speak this evening. Just to give you a bit of background, our YO Society was formed in 2017, and I've been involved since the inception, initially as a committee member and now as the chair. We were growing from strength to strength. In 2017 and 2018, we had a YO meeting that was piggybacked onto the National Society meeting. And then in 2019, we hosted our first OSA YO weekend with Ike Ahmed as our guest speaker. And obviously the plan was to have an annual meeting after that. But then 2020 happened. 2020 was off to a great start with the Global YO Symposium in Singapore. We all had a lot of plans to collaborate and meet up at international meetings, but then the world as we knew it obviously just changed. And in South Africa specifically, the COVID-19 pandemic brought with it much disruption to our 2020 plans. Obviously, the biggest blow to South African ophthalmology was losing the World Ophthalmology Congress. And because the majority of our YOs are in the public sector, they will move to frontline work, affecting their surgical training, their academic training, and obviously their YO activity as well. So we definitely lost momentum in 2020. But working during the pandemic brought about a slight change in the trend of the cases that we saw, especially regarding trauma, we were only seeing emergency cases during the hard lockdown. And after catching up with my friend Diva Kanti, actually prompted me to conduct a survey in ophthalmic trauma during the lockdown period. Prof. Natarajan and APOTS also got involved, and with their valuable connections, we were able to get some global interest in the survey. The South African perspective was that trauma was largely caused by alcohol-related assault in the public sector prior to the pandemic. And in the private sector, we were mostly seeing injuries on duties before the pandemic started. And just to give you a bit of background with regards to the alcohol-related trauma, in order for South Africa to prepare our hospitals for the pandemic, the government actually banned the sale of alcohol to reduce the burden of trauma patients on the system and to free up the resources to basically cope with the increasing number of COVID patients. So the majority of trauma we saw after the lockdown completely changed. It was now DIY or do-it-yourself injuries. We saw more domestic abuse injuries, and we saw a lot of accidental pediatric injuries that happened in the household. I think the best thing for me to come, or that came out of the survey, was that I'm currently in the process of starting the South African Trauma Society. And with the help and guidance of APOTS and Dr. Natarajan, we are spearheading an African Ophthalmic Trauma Society. And this platform will allow all of Africa to share their experience and their skills with regards to trauma. And I'm really looking forward to this journey. So just thank you to Yosi and Divakant again for the invitation to talk this evening.
Wonderful, Sanushka. Thank you so much for that insight on trauma in your country. And it's so interesting that we have a similar story in India as well about trauma. So thank you for sharing. Thank you. So next we have Mays Alkilani, who is the founding president of the Young Ophthalmologists of Jordan. So Mays.
Hello, everybody. Can you hear me? Hello?
Yes, yes.
Yeah, okay, great. So thank you, Yosi, and thank you, Divakant, for this invitation, and thank you for all what you do for young ophthalmologists. You are actually leading by example, and we're very happy to be part of this meeting today. So my story is a bit different. It goes back to 7-year-old me in drama club. I was the youngest on stage, given some minor role and not actually liking it, and not liking to be bossed around, refusing the fact that if you are the youngest, you cannot take the lead role. So a couple of weeks into rehearsals, I kind of memorized the role, every role in that play, and stepped up and asked for a recast. Because to be honest, that 6th grader who played King, which was the leading role at that time, did not even know his lines well. Well, good thing I got the part and I played the king. Fast forward a couple of years ago, I graduated my residency. I met with Dr. Mike Brennan, who introduced me to the concept of YOS, because I didn't know that there's such thing as YOS societies. And he was like, why don't you start a YOS society in Jordan? At that time, I was having my biggest wave of self-doubt, and I pondered who would listen to me actually, because I was very young. Then that 7-year-old me, who was not filled with intrusive thoughts and preformed ideas about what age someone should be to do something, took over. And I came to realize that who we are and what we do as ophthalmologists and as doctors is a daily practice of advocacy and leadership. When we diagnose or operate, we are the leaders of that clinic or that OR. And here is where YOS societies come in play, to remind each other that we are the leaders, to provide YOS with tools to lead, to connect them and empower them, give them equal opportunities for jobs and education. And most importantly, reminding them to vocalize their needs, to communicate. You'd be surprised how many people are going to huddle around your fire and work with you more often than against you. And maybe you'd wake up that 7-year-old you and get to play king. That's how we started the Young Ophthalmologists of Jordan, or as we like to call it, YOJO, with communication. We have managed to start a scientific agenda that benefits all YOs. We are creating an outreach program and customizing our society to tend to the needs of Jordanian young ophthalmologists, which ultimately would give us both a platform and a chair on the big boy table and involve us more in shaping the future of ophthalmology. This, in turn, would elevate the level of patient care because we are, in fact, the frontliners of this industry. And by being well-connected and empowered, we would be connected with our inherent inner leader that will make us better advocates for ourselves and our patients alike. Thank you very much.
Wow, that was amazing. And thank you so much for sharing. And you seem definitely like someone whose fire we all would like to huddle around rather than work against. So
Thank
thanks. I
you.
really love that line you use. So thanks so much. And next we have Sarah from Morocco, who is the General Secretary of the Young Ophthalmology Society of Morocco. Lovely story about the 7-year-old you as well.
Okay. Do you hear me?
Yep.
Hello?
Yeah, you're on. You're on.
Yeah, okay, great. Thank you. Thank you for the kind invitation. Thank you, Diva. And I saw a lot of people that I knew before. Diva, Sanushka, hi, hello. Okay, great to see you guys. Okay, thank you for the invitation. I'm Dr. Idman Sara, and I will talk on behalf of the Young Ophthalmologists of Morocco. I'm the General Secretary of Young Ophthalmologists of Morocco. And after I will tell you my anecdote, and I hope it will be funny. You must know for relevance that I did my med school in Russia, and after that I moved to France to do my residency. So after that I came back to Morocco and I started working at a public hospital for 1 year. One day I was in the consultation, and one patient came and he's complaining of a fingernail problem. So I was like, okay, a fingernail problem, and he's coming to see an ophthalmologist. Okay, that's funny. And I start checking his hands and thinking, okay, what is the problem that can cause both, like an eye problem and a nail finger problem? And after that, he said, no, I came for my eyes. And I was like, okay. I sat at the slit lamp, and I was like, okay, maybe he got a fingernail as a foreign body. I was checking up at both eyes, and I was like, I just noticed a huge pterygium. And I was like, okay. I start explaining to him that he got a pterygium, but using this word, the pterygium. While I was explaining, one of my colleagues came in, and he, in 1 second, he said, yeah, you have a fingernail problem, and we will do a surgery. And I was like, okay, fingernail problem. And he said, yeah, the fingernail means in medical, the Arabic word. I don't know if the Jordanian doing the same thing, but the fingernail, it means pterygium. I was like, okay, and everybody started laughing, and I was like, okay, even though this is my native language, it starts in confusing for me. Practice maybe 6 months or something like that in Morocco. You must know that the nail problem, like a nail finger, that means pterygium. Voilà, that is all for me.
We learn new words in our own language sometimes. Sonal?
So I'm really happy to invite our next speaker, who's an assistant professor at the Department of Ophthalmology in Jeonju, South Korea. And Dr. Lee is specifically interested in neuro-ophthalmology, strabismus, and pediatric ophthalmology. Welcome, Dr. Lee.
Okay, good evening, everyone. My name is Hangjin Lee, and I'm a chair of KYO, launched recently. It's a very pleasure to be here to speak as a representative of KYO today. And I want to introduce some programs in Korea. There is a one-night orientation for young ophthalmologists who are starting working in the hospital. It is a time to participate in the first year after starting a residency. So although they don't have much experience, it's a time to share episodes that occur while dealing with patients or with other colleagues. And this day is also a very precious time in the midst of very busy times with poor sleep. And for me, I also had time to share experiences with others from all over the country when I was a resident. So as a chair of KYO, I'm planning to make this social time a little more enriching. And there are lectures for young ophthalmologists at the annual meetings in South Korea held twice a year. So when I'm a resident, it was really helpful. Because of COVID-19 and social distancing in Korea, most of conferences were held online last year, as you well know. And I think there are some advantages and disadvantages as well. It is very sad not being able to meet and share opinions in person. However, these days, people on the other side of the globe can communicate immediately using internet, SNS, or like that Zoom meeting. So in this respect, some of my colleagues like it because it was rather convenient to access the information. So this situation is probably going to last longer, and we are quite getting used to it. So a coming annual meeting in South Korea is also playing online, and we plan to communicate using these advantages of being able to access the information quickly. So as I said earlier, we are just starting out in Korea. So we'll focus on developing an online education system that allows easily sharing the information among ophthalmologists. And I hope KYU could make a leap forward based on what I have learned in this colloquium today. Again, thank you for having me. Thank you.
It's so great to learn that you people are just starting off now, but are starting off on such a positive note in such difficult times. I'm really happy to share that our AIOS General Secretary, Professor Namrata Sharma ma'am is here with us today, and she would say a few words of encouragement to Dr. Lee from Korea. She's just shared the story of her Young Ophthalmologist Society in Korea.
I think I've been listening to all the people who have talked about their experience. It is heartening to know that all of the young ophthalmologists, not only in India but globally, are coming out, and they are forming their own societies. They have their own aims and objectives, despite the fact that their own national societies are already in place. Because obviously, yours have a different set of problems, different ways of finding solutions to the problems. We might find some solutions for you, but you would find faster solutions for yourself. I would particularly like to appreciate our own society first, the Young Ophthalmological Society of India, who came into existence earlier than all of you. And I think YOSI is infectious. YOSI is infectious because it seems to be infecting everybody globally. And I'm proud of YOSI, and I'm really thankful to YOSI. And I think all of you should work together, and that is the way forward. Like somebody said, it is about breaking barriers and creating frontiers. So I've listened to each one of your stories, and it's really nice to know that you are moving forwards.
Thank you so much, ma'am, for your kind words. And you are the real force behind, our success today, and our global reach is kind of an offshoot of your encouragement only, ma'am. Thank you. So I would like to now request the next speaker, Dr. Muhammad Bayu, who's representing the Young Ophthalmologists of Indonesia. He's a vitreoretinal consultant and head at Yogyakarta, Indonesia, and he would be sharing his anecdote with us now.
Thank you very much for everyone. Thank you for inviting Diva. Thank you for organizing this. So I would like to share a story of my life. It's probably a bit different to other that the roller coaster of my life. So it's been a long journey for me, but things did not go according to the plan most of the time. So initially, I remember exactly when I was in high school, I always wanted to go to military high school, but I ended up doing a public school, which is very relaxed. But then I wanted to do engineering. And then I ended up doing medicine because my parents forced me to do medicine. And then during the medicine, I didn't really enjoy, but I have lots of friends. And so that's why I was thinking to become a non-practicing doctor, doing admin or management things. But then I ended up doing clinical work. Then I wanted, initially my first preference was cardiologist, but then I ended up doing ophthalmology. And during the training, I really hate surgery. I really hate cataract surgery. I remember the first time I did my first cataract surgery, the microscope makes me very dizzy. and I threw up after the surgery, and I almost passed out for half an hour after the first surgery. So that's why I really hate doing surgery at that time. But my mentor, the consultant, pushed me and forced me to do more and more surgery until at the end, I think, oh, this is actually not too bad. And I started loving it. And then I wanted to do cornea. I really like cornea, but then I ended up doing retina. I didn't really like surgical retina. I always wanted to do medical retina, but then again, I ended up doing retinal surgery. And then when I was thinking to do my postgrad study, I really wanted to go to US. I ended up doing it in Australia. And then I applied for a Toronto fellowship. I got the position, but for some reason I had to cancel it. So I went back to Australia to do my fellowship. And again, in organization, I actively involved in our college and professional organization in the country. And I was not supposed to organize or to chair this young ophthalmologist division. But then, yeah, again, someone recommended me, and then I ended up looking after our young ophthalmology fellows around the country. So things almost never go according to the plan. I think that's the apparent from my experience. But I think the bottom line is for us, it's always good to have a positive attitude. Sometimes we can do better if we just do it, even though it's not part of our plan, and we can just try to be resilient as much as possible. And it's also very good to work in a team. I have a very nice and varied quote here I share to you all because part of the thing that makes all my journey feels easy is I try to work in a team as much as possible. So there's a very nice quote from Ronald Reagan: "There's no limit to what a man can do or where he can go if he doesn't mind who gets the credit." And that's what this Minion does. If you watch a Minion movie, at the end of the day, I've got a lot of questions asking, what's your biggest achievement so far? Is, I think, yeah, always come back to family. This is biggest achievement. Thank you very much.
Thank you so much. You've reminded me of that anecdotal proverb, in a way that man proposes and God disposes, but he ultimately leads us to where we need to be in our life. And it was so beautifully, shared by you in your story. And yes, family is the most important, and teamwork is the platform which brings forth beautiful results. And it's the teamwork between the various YOSI members that has brought forth this whole program today. And I'm handing over the proceedings to Dr. Apurva for the next speakers.
Thanks, Sonal, and thank you for that great story, Bayu. So next we have Dr. Hyun-Da Chu, who's from the Taiwan Ophthalmological Society, the YO Committee.
Hello, my dear friends from India and other parts of the world. I'm Hyun-Da Chu from Taiwan. I congratulate on YOSI for the amazing event and thank you for inviting us. Today, I'm here with Dr. Tai-Chi Lin, and we are excited to announce the formation of the YO Committee in Taiwan Ophthalmological Society. Our official birthday is this weekend, and extremely happy to meet everyone right after delivery. I serve as the General Secretary and Dr. Lin holds the chair. We look forward to more collaborations with all the YO leaders here in the future. And my story today is from my junior resident. And shortly after I become a consultant, one day in the operation room, my resident asked me a question that gave me a lot of thoughts. And he asked, Dr. Honda, is your life much happier after becoming a consultant? Well, I think for a while and recalling my life as a resident, definitely it was quite miserable. Trained in the largest medical center in Taiwan, as a junior resident, I took care of all the scout work and saw around 10 to 20 emergency consultations per call. As a senior resident, I involved in exhausting administrative work and had the constant pressure of publication. And as a VR fellow, I literally lived inside the hospital and opened my eyes to do vitrectomies and closed my eyes dreaming of doing it. Here, the constant pressure, sleep deprivation, and I'm breaking with my girlfriend. A sad story. So now, as a consultant, I indeed have much more freedom in organizing my work and life schedule. However, if I compare the happiness of training and consultancy years, I was generally happy and enjoying my life in either role. So why? My resident asked. Well, for me, I think the joy of life comes from completing one challenge after another and the feeling of getting better day by day, no matter a huge victory or a trivial progress. I'm not very greedy, so my goal is be a better self than yesterday, no matter how small the progress is. So with this simple goal, I can keep moving forward and constantly celebrate my small achievements every day during the whole process. That is the reason why I generally feel happy every day, no matter as a miserable resident or as a consultant. So I too hope my stories today will be useful for my resident and the YOs here today. I wish all a brilliant life as a happy ophthalmologist. Thank you.
Thank you so much, Honda. And yeah, as a VR fellow, all of us, open our eyes to do vitrectomy and close our eyes dreaming of doing vitrectomies. I could totally relate to that. Thank you so much for your story. And now, since we have about 3-4 minutes, I invite Dr. Namrata to share an anecdote from her life as a young ophthalmologist. Namrata, ma'am?
Yes, Purva, it's a very difficult,
May I interject for 1 second? I really want you to share about how you went about doing your publications as a resident. You said you always close the publication every weekend. Please tell us a little about it.
So about publications, I do feel that one thing that you all should, the young ophthalmologist should understand is that no publication should remain in your computer for more than 48 hours. And within 48 hours, it should leave your computer and it should be on the net. Because what happens is what you want to do is make it, perfect it, make it better and better and better. That will never happen. The moment you send it for publication and you think it is absolutely all right, when it comes back to you for a revision again, within the next 24 to 48 hours, it should leave your laptop. It should be on the internet somewhere. It should not be on your, laptop or desktop or whatever new thing that you come across, whether it is a new indication, a new complication, a new way of doing thing, just publish it. Because everybody is very intelligent. All the ophthalmologists are very intelligent. All the ophthalmologists are thinking. All the ophthalmologists are writing. And so it is not about, your intelligence, but it is about your speed. So the one who does it first, gets a stamp on it. So you have to fast forward yourself, on that. And I think you have to have great mentors. But now I see young ophthalmologists, on their own taking up the projects, the subjects, doing an innovation or reading about it and then publishing it. Everything is very quickly done online. So every weekend you should see all of them off. Don't keep them, we have this habit of thinking that I will make it more perfect. It will not happen like that. Let the reviewer make it more perfect for you. It will come back to you once or twice, doesn't matter. But then they would have thought differently, which you will not think. You keep seeing it and keep thinking the same thing. So it is best that it goes there. And then don't even be too over ambitious to get it, in the best journal of the ophthalmology. It doesn't matter. It should be there on the PubMed. It should be listed. Your name should be there. And that is what is most important. So that is the way, how you should go about with publications. I think all of you are doing great number of publications, and I don't see any much guidance which is needed now.
Thank you so much, Namita ma'am. That was really nice. And Divakant, I think we have wrapped up this session well within time. Do you want to take over and start the next session? We have 1 minute to do.
So I like I said, Apurva, yours will never, they will never exceed time. I have, with experience, I can tell you, it is seniors like us who have to be told, you are exceeding time now. But I've seen whenever you do plan sessions with young ophthalmologists, they're always on bang on time.
Thank you, ma'am, for that compliment. Karan, are you there?
So I think this is
Yes, I'm here. Yes, I'm here.
Session. Yes. So this has been a wonderful session, and I thank all the EO leaders from across the globe who've joined us so far. To name, we're looking at Bangladesh, Philippines, Jordan, Morocco, South Africa, Indonesia, Malaysia, Hong Kong, Taiwan, and the names are going to go on because we have more and more countries that are going to be represented soon. And this session was indeed interesting with all the anecdotes that we heard. And the next session is going to be as interesting. And all of you, please be there, please participate. The next session is going to be about the evolving role of the Young Ophthalmological Society, of the Young Ophthalmologist Society across the globe, as well as about how we can collaborate better. So that's very, very important, right? I mean, like we say, no man is an island. I think no society is an island. And at the current time, and you have to collaborate with societies within your country, with other specialty societies, with societies globally. And here, of course, since we are all, have the global leaders, we're going to talk about how we collaborate on a global level. And I'm Dr. Digvijay Singh. I'm currently the president of YOSI, and we have Dr. Devakant, who all of us know, who's the general secretary of YOSI. So without much ado, to have maximum discussion time, I'm going to ask Devakant to introduce the speakers, and then we're going to ask you guys some interesting questions.
Thank you, Dr. Digvijay. And I think the key to being on time is not to waste too much time in introducing the panelists. So we have Dr. Lakshmi Hariharan, who is on the AIO International Subcommittee, and she'll be representing AIO. Then we have Dr. Danson Mutuvelu. He is the past chair of FAYO, that's the Danish EO, and that's the oldest EO. Now, all of us know that. Then we have Dr. Zubaida. She'll be today representing the APAOU, the whole committee she'll be representing. Then we have Dr. Mary Louise Rasmussen. She's the past chair of SOEO, and she'll be representing all of Europe for us here. Then we have Dr. Camila Ventura. She will be representing the Pan-American Academy of Ophthalmology, YO. And then we have Dr. Wong Chi Wai. He's the present chair of the Singapore Society of Ophthalmology, Young Ophthalmologists. And last but not the least, we have Dr. Joy Leung. She'll be representing the Hong Kong YO Society. She's presently chairing the Hong Kong YO. Over to Dr. Digvijay.
Right. Thank you, Devakant, and welcome everyone. We're eager to now hear your thoughts and opinions. But before that, let me begin by saying that, if all of you could introduce your society or your chapter briefly, and then tell us about the most popular activity that you have for the young ophthalmologists. And I could start with Dr. Lakshmi.
Good morning, everyone. Can you hear me? Is it on? Yeah, okay. Yes. So it's an honor to be here. Thank you so much for inviting us. I am speaking to you from Miami. I am representing the American Academy of Ophthalmology YO International Subcommittee. And one of the most unique, fun events that the YOs have every year at Academy, we host a lot of social events, networking events. And unfortunately, in these unprecedented times, we weren't able to all combine together this year, but we had our first ever virtual global young meet and greet. Global Ophthalmology YO meet and greet, and we launched social media as well as newsletters that everyone were involved with, and so we've really worked hard to still keep connection even then we couldn't meet in person. And so, and this is a perfect example of that. Virtually, it's possible for us to still have that feeling even if we can't meet.
Right, indeed. I think this, virtually we've become closer in a way, but yes, nothing beats a physical meeting. Danson, I think yours is one of the oldest societies. What?
Good afternoon. It's great to meet you all, and it's great to be part of this meeting today. I think even though the world has changed, it's all about connecting people. It's about knowing each other. And of course, that's really nice when we do that physically, because, all the content we have online is always very serious, and it's about the facts and about things. But I think a very important thing is also the social thing about knowing each other. And I think combining those things is how young ophthalmologists across the world can become even better by inspiring each other.
Right. And
thank you.
About FAO as well. I mean, I think everybody wants to know about one of the older societies that's, that also got YOSI to get started.
Yes. So I think Denmark, it started very early on because there were some frustrations among the young doctors at that time in '81. And of course, there have been a lot of experience during that time. But I think in all that time, it is about the young ophthalmology. It is about the people learning each other. And I think there's a great support by our members because, the young ophthalmologists want to meet each other. So it's a perfect platform to socialize and learn each other. I think the social element is the most important element. And actually, I think that's also very well represented in that our annual meeting, which we could not do last year, actually, due to the COVID, is something people look forward for because it's just as much social as it is about the the topics and the discussion in ophthalmology.
Right. And Dr. Zubaida, about the APOYO and about the activities, most popular EO activity that's done.
Okay, I'm Dr. Aquino. I'm from the Philippines, and the YO group in the Philippines is called PINOY. It stands for Philippine Network of Young Ophthalmologists, and it is very apt because PINOY acronym is also refers to the colloquial term for members or people of Philippine heritage. So that's Pinoy, so that you will remember it well. And I think the Pinoy was established about 6 months ago, and it's very young. So the most popular activity is also the first activity that launched officially the Pinoy. So this was the retinopathy of prematurity public awareness video contest, which we held last August in celebration of the Sight Saving Month. So I think at this time, the YOs were very hungry for something to do because of the lockdown. So a lot of people submitted entries, and because one of the criteria is the social media engagement, they were very eager to share and like the videos. And so with this activity, there was increase in traffic in our Facebook page, and that made this very successful. So regarding APAOYO, okay, should I go ahead and discuss about APAOYO?
We'll come back to you for that.
Thank you.
So, Dr. Mary Louise, Dr. Camilla, something about your best you activity.
Mary Louise, do you want to start or should I begin? Okay, so hi everyone. I want to thank very much the invitation. Thank you, Diva, and congratulations, YOSI, for this amazing group and activity. I'm so impressed by all of you and all of what you have done so far. I am Brazilian and a retina specialist, and I represent the PAIOS-YO, the Pan American Association of Ophthalmology. Our group, our YO group,
started in 2017, so I considered it very young as well. But we have a lot of history. The Pan American Association of Ophthalmology exists for over 80 years now. And I think, you know, the PAIO has transited like this year because we all had to change a lot of what we were doing. Before, when we had our physical meetings, we started having symposiums and social events that I would like to echo what Lux said and Dan said, that social events are the most important for YOs. And when we're talking about a supranational, such as the Pan American, we need to have those kinds of events so people can gather and exchange experiences. So now that we are going through this, you know, unprecedented situation in the world, we started doing webinars, and I think that was the most popular activity that we did in the past year within the Pan American YO. Thank you very much for the opportunity to talk.
Well, then I just take over. My name is Marie-Louise Rasmussen. I'm from Denmark also. So we're two Danes here today. I'm the past chair of the European Society of Ophthalmology. We are including all European countries, including Russia and all east of Europe and north of Africa. So Egypt and Tunisia, Israel, and many of these Middle East countries are part of the European Society of Ophthalmology. So it's 44 countries. And we have a young ophthalmology group who goes about 12 years back now, collaborating wildly around the world. Our meeting in Europe is biannual. So according to the plan, we should have had a meeting this summer. It has been postponed due to COVID. I think most activities in Europe has actually been declining due to the COVID crisis. And right now in many countries, many young ophthalmologists are not working as ophthalmologists. In UK, most ophthalmologists are working at intensive units. So it's a big crisis currently and really a sad situation. So I must admit that our most exciting activities in 2020 was our newsletter and participation in all these virtual conferences around the world. But I'm gonna later have questions about how we organize so many countries. But what I will say is our most popular activities is actually a biannual meeting as well for all the young ophthalmologists exclusively, called the European Meeting of Young Ophthalmologists. So that's basically it.
I think both of your societies or chapters do cater to a large number of countries, and we will be getting back to you on that. Dr. Wang Chi, we'd like to hear from you about the YO activities there, the most exciting YO activities.
Hello, hi. Glad to see everyone here again. And thank you to Diva Khan, yourself, as well as YOSI for inviting me. So Singapore Society of Ophthalmology's YO chapter, we were established in 2017. So similar to PAIO, and we are also very young. And in fact, I took over just this year from Dr. Marcus Ang. I'm sure most of you here would know him. And that was just 2 weeks before the lockdown in Singapore happened. Yeah, but fortunately, I think we had a great session with many of the YO leaders here in Singapore in January at the Global YO Symposium. So again, I think I really echo many of the what the speakers have said about social activities. In SSOYO, the most popular activity is also social events. And we have a YO night once a year where we gather everyone. And I think it's under a more relaxing environment that people really start to open up and make friends and even come up with collaborations. And during these nights, we also have events like in the most recent one last year, we had a artwork event where the YO submitted their artwork related to the eye. And the winners of this competition, we actually used their artwork on the tote bags in the international symposium that we had earlier this year. So this YO nights occasions where the YOs can showcase their talents, make new friends. Sometimes even though Singapore is such a small country, we hardly meet up. Everyone is so busy within their own spheres and their own duties that we hardly get to meet up. But at this YO nights, really make a lot of new friends and strengthen old ones as well.
Thanks. And indeed, I think, yes, the YO nights there are something that the YOs look forward to. And okay, we'll quickly come now to Dr. Joy and about the activities and the most popular activity there in your society.
Hi everyone. Thanks Yosi and Diva himself for for the invitation. I'm Joy from Hong Kong, and Hong Kong YO, very similar to Singapore and also Pan American Society. We started in 2016, so relatively young compared to many other societies, including Yosi itself. Our most popular activity, just like many others, it's a social event. So we have a YO drinks that is held in August every year. And the reason is because we have new intake in July. So the August event is kind of a welcome event for all juniors. And we also invite seniors to join. So there's kind of like a YO event with some seniors who are interested to meet the younger ones. So it's a great event where people, relax over drinks. We have we try to get places where there might be some games and stuff and karaoke as well, so everyone can really, kind of relax. We try to get it on a Friday night so no one is working the next day either. So, however, because of COVID again, it was cancelled last year, and now the most popular event is actually the a YO Symposium. That is an annual event at our annual scientific meeting of the College of Ophthalmologists of Hong Kong. And I'm sure I'll be able to share more about the YO Symposium in later parts of this discussion. Thank you.
Thank you, Joy. Devakant, over to you.
What we have learned is that a social event is really important from all our speakers, and surprisingly at EOC we haven't had a major social event so far. So that is something, whenever we start a new the physical meetings, we should definitely have it, and we would need Dr. Namrata ma'am's support also to have a YO night during the AIOC meeting as well.
Sure, Devakant, you will have YO night as soon as you have the next AIOS meeting.
Thank you so much, ma'am. So let's move on to some specific questions. And the first one is with Dr. Lakshmi. YO is it's pretty old and a very popular YO organization, and has been the source of inspiration for most of us so far. So we would really like to learn from you what has been the impact of your society for over a long period of time, that we can also know how we can more help our.
Sure. So one of the things I think, so the way that the Academy defines a YO is any resident or fellowship that is in the first 5 years of training. And so it's a very specific community of people that just started, they're just launching their careers. And I think the main goal was to give them a seat at the table and a voice, because often as we're, I think a lot of people were sharing stories when you're starting, it can be very overwhelming. You don't know where to go, if you have questions, who to ask. When you're a trainee, you always have your mentors and you can directly talk to them. But this kind of special period of time where you're launching and having a support system. And so that's really what we focused on, is developing a community of young ophthalmologists that meet these criteria in the first 5 years, and giving them an outlet for support. We have three subcommittees. I'm on the International Ophthalmology Committee, but we have an advocacy committee that's very, very important for giving ophthalmologists a voice. And the other part that's very unique is that we encourage, the academy actually really listens to our voice, because I think having a seat at the table, so a lot of the senior leadership at the academy, they always ask for what is the YO input, or what do the YOs think about this? And I think that bridge between having a community, but also having access and input in the academy and shaping the academy, I think that bridge is very important. And so they've worked really hard for that. And also a newsletter, that's been something that we actually invite all of you, any YOSI that you have clinical pearls, or if you have an article, as Dr. Sharma said, getting it off the computer and into the cyberspace. So we actually have an outlet for that. So there's a wonderful newsletter that we have a subcommittee that we welcome everybody's voice. And so those are kind of the ways that we've worked really hard to give our young ophthalmologists a voice. And I just wanted to say one more thing. I think what's really unique of how you brought us all together, I myself am from India. My name is Lakshmi. I was born in Hyderabad and grew up in the US. And I've worked with a lot of you guys on this call. So I think what's really amazing is, even if we are, in different parts and representing different countries, we have so much more in common, and there's so much potential for collaboration. So you already are doing social events by having this. So just wanted to commend you for that.
Dr. Digvijay.
Thank you, Lakshmi, for that. And I think, just like AO is working, the YO subcommittee as a good bridge with the AO, I think with the AIOS, through Professor Namrata Sharma and the AIOS office bearers, we have a good bridge, and they're very often listening to us and guiding us all along, so which is great. Danson, I'd like to come to you. So, FAO is the oldest, YO society, and I think it's got a lot of rich experience in helping out the young ophthalmologists there. What lessons have you learned as a leader of the FAO, that you could share with us?
Thank you. I think that's a very excellent question. I think I've been the leader for FAO during a 6-year period, and I stopped last year. And I think the history and the tradition and the things that has been built has been quite amazing, because it's 40-year-old. The society is 40-year-old. There are a lot of experience that is within the society, and I think what is very interesting is that a lot of that experience and knowledge has been kept within the society. And I think building, onto others' knowledge and know-how, has really helped us to improve things and developing things and making things much better. And I think what I really had to learn is also, to talk and manage different types of leaders in ophthalmology, within the educational committee, and and how to engage and how to present, because there are a lot of politics in this as well, and there are a lot of political interest. And as a young ophthalmologist, I think it's very important to be diplomatic. So I think one of the things I also learned is to be diplomatic. And yeah. Did I answer your question?
Yes, I said that is an interesting lesson to give across. Diplomacy is the key.
Yeah.
That's the most important lesson, Digvijay, out of the whole thing, because they are so experienced that, Dr. Danson very, very nicely has stated that you have to be diplomatic.
Yeah, that's why he's diplomatically stated that
yeah.
Probably is actually a very valid lesson for any society to function smoothly.
Yes.
Thanks for that.
Yes. So, yeah, but I'm very happy to be here, and as a fellow Indian as well, just like Lakshmi, I'm actually born in Chennai. So for me, it's also very great to be part of this. As a NIA, there, I think a lot of people from, in the global perspective that have some Indian roots. So it's great to be part of this meeting today.
Just telling Lakshmi that we have exported a lot of your leaders.
Yeah.
So next, we are coming to Dr. Kuno again. So we would like to hear more about APOYO. So it has recently become really active. So what are the activities that the committee is planning, and more words on it?
The APAO, or the Asia Pacific Academy of Ophthalmology, YO, Standing Committee was created in 2010. And under the leadership of Dr. Fang, we were able to organize various symposium during the PAO Congress. And with the local hosting societies, we were able to come up with social events, which were very popular. And also we were able to give recognition or awards to deserving YOs during the APAO Congress. But then we realized that we don't want to just limit our activities within or during the period of the APAO Congress. And we want to have a continuous and consistent engagement with YOs and collaboration with YOs. So I think the silver lining of this pandemic is that we were able to slow down from our very hectic schedule, and we had the time to group ourselves, to organize. And I'd like to thank Diva Kant and the other YO leaders for initiating the WhatsApp chat group that we had. And through that, we were able to collaborate more and prepare for future activities for the APAO YO group. So for our next activities, we are preparing for the launching of the social media presence of APAO YO. This is very important because I think the social media is integral to the part of collaboration among YOs, because all YOs are social media savvy, and so we can all communicate through social media. And through the social media, there are a variety of contents that we will be putting out there about education, advocacy, fellowship, mentorship, and also communication. You can communicate with other YO leaders from other countries and collaborate. So we invite the APAO YO Standing Committee invites everyone to please expect or await the launching of this social media presence, because we will also be giving out awards throughout the year. So we have prepared awards for best video, best influencer, most interesting case, and other awards. So please watch out for that. Contribute your content, and so that we can have a very robust and dynamic social media presence. Okay, and also I would like to say that the key role of APAO YO Standing Committee is to coordinate the concerted effort to provide opportunities and cultivate the potential of the YOs in the region. So through collaboration, we are able to break barriers and hopefully contribute also to the progress of ophthalmology in the region. So it's very important to communicate, for information sharing, learn from each other so that we can have a better ophthalmology and improve our practice also. Thank you very much.
Thank you so much, Surya. And yes, APOU has become really active, and we would like to take the opportunity to again thank Dr. Namrata Sharma for getting us on board. She nominated us to be part of the standing committee, and that gave us the opportunity to contribute there as well.
Indeed. And this is so the next question actually that I have is going to be for Dr. Mary Louis, and Dr. Camilla can also pitch in, because this question is something that India is a huge country, and we have a lot of state chapters of YOSI now, and we try to coordinate among them. So your society is SOE, and Pan American Society is also coordinating among a lot of countries. So how do you go about doing that, and how do you manage that that task? It's very daunting, I feel.
Camilla, should I start? I actually prepared a small slide for you, if I'm managed to share it. Maybe I don't. No, but anyway, the thing is that we have 44 countries, and every country have a national representative. So each country is represented by one young ophthalmologist. And we actually try to keep track of these people and hear what the political issues are in their country, what the social activities are in their country, if there's something we should advocate for, or where we can spread the news or invite people to take part, share photos. One of the huge difficulties in Europe is that we have so many languages. Luckily, I think we are the first generation who are actually able to speak British. And it's very new for the Eastern Europeans. They speak Russian mainly. They learn Russian in school. So that gives us a really huge variety and diversity, which is quite interesting, but it also is a major concern sometimes. Mostly language problems, but also cultural. There are some huge varieties there. What we have done to strengthen the political scene is mainly to help and assist creating national societies. And as you heard before, I'm from Denmark, so I'm from the same tradition as Dansen. And I'm grown up with making societies. That's what we do in Scandinavia. So I've been traveling around in Europe, helping people to make young national societies, because that's, first of all, the pathway to make a voice for the young ophthalmologists. But it's also a way of giving them nationally a political voice, and make sure that they have a democratic system, how to elect the national representatives, but also to form a board nationally, so they can make meetings like this and get together and make newsletters in their own languages and help each other. One of my key points is always that it's your organizations should never fall back of being the party committee, because all the young ophthalmologists, they love to have a party. They love the yo night out. But the most important thing is not to make the yo night out. It's actually the political movements, because that's where they change their education. That's where they take responsibility for their future and their career. So I will say that in Europe, that has really been a huge issue over the last 10 years, and we're still growing. I can tell you the newest example of a young ophthalmologist society is actually from Norway. So it's not that all Scandinavian, Western Europe countries have had young societies for a long period of time. Denmark is outstanding together with United Kingdom in that matter. Many of the Eastern European countries have actually had young ophthalmologist societies for a long period of time. And secondly, one of the issues when you're having many nations that we haven't really dealt with yet is that it's not only a matter of diversity in language, educational length, politics, and stuff like that. It's also a matter of how many members each nation have. So where me and Dansen is from, we might have 100 young ophthalmologists. In Romania, they are 8,000. So when you have countries with so many young ophthalmologists, it needs another structure, and it might need another board and way of electing members and keeping memberships than in smaller communities. Yeah, but to secure a democratic process where everyone have a voice has really been a major concern in our area, and I think we have succeeded in that over the last 5 years, so things are improving.
So I agree 100% with everything Marie-Louise just said. It's challenging to be co-chair of a society that big, a committee that big, that also we also share the situation of the language. So at the Pan American, we have people speaking Spanish, English, Portuguese, and French. So we are starting to have French countries interested in joining the PAO. And I would say that that is the most interesting part of it, actually. We get to share so much, and we do have a lot in common. All the young ophthalmologists, they are eager to learn, to cooperate. Many of them are leaders themselves in their country. So we have a very similar idea as SOE, because we have delegates from every country. Not every country so far. We want to reach that, but because it's not easy to put together a team, we have so far 44 delegates from 20 countries. And these delegates, they bring new ideas. They, like I said, they are leaders themselves. And how did we start all of this? We need to go back in time, because the PAO as well as the AAO, they they host a leadership course. And this leadership course I did it myself, and there is where you get to meet all these young leaders that want to develop their leadership skills, and over 1 year or 2 years they will be part of that group, and it's very miscellaneous. Like, you have people from all the Pan American countries, and we just get, like, here we start seeing familiar faces, we start making friends, and every time we go abroad, we are in a different meeting, we socialize. And that was how we started. But I would say that now we are facing, because of COVID, we had many more meetings. And like, I forgot who mentioned, we got, I think it was Dr. Aquino, that said that we were able to stop and organize ourselves. And we started having monthly meetings, and we got to know more of each other, because at first we would meet, before COVID, we would meet in meetings, and it would be like 6 hours everybody together trying to put the next meeting, and organize the next meeting. But for a year, we were working monthly, and we were following on our projects. So I would say that there's a lot of silver linings to COVID, and that is one for the Pan American YO. We got to organize ourselves much more. We now have a annual plan. We have leaders taking over different projects, and for me as a co-chair, it makes my life much easier when we have all these delegates working together for the same goal. And I would say that the language is a challenge. Like, for me, I speak much better English than I do in Spanish, but it also makes me want to speak better Spanish. So it just, gives so much opportunity, and I have learned so much being in this position so far. I don't know how about you guys, but I think the other challenge being in a supranational is how to transit from one leader to another, the succession. It is not easy for me to train someone to take over, because the person is not in the same country. But this year everything changed a lot, because we got to have the virtual meetings. But being in a supranational and having to do the succession is not as easy as a national YO society. But I would like to thank again. It's a pleasure to be here with all of you.
Thank you. I think those are kind of unique challenges that both of you have been facing in your societies.
So next we have Chivai, and we would like to know that the SSO-YO has been supporting YOs tremendously during the COVID-19 pandemic. So can you tell us more about how?
Yeah, so I think similar to similar to a lot of other countries, the young ophthalmologists in Singapore were quite severely affected by at least at the beginning of the pandemic, because there are a lot of restrictions on cross-hospital movements. So some of our trainees were stuck in peripheral hospitals, and of course, elective surgeries were deferred. So that again has a huge impact on our younger residents who are just starting out to learn surgeries. Clinic schedules were disrupted, and of course, perhaps most importantly, teaching sessions were also cancelled. So there was a lot of anxiety, a lot of uncertainty as well among I'm sure not just young ophthalmologists, but everyone. And in Singapore, we had a unique opportunity to actually step up to the front line to look after COVID patients, because we have our infectious disease facilities, COVID screening areas, and also, as a lot of you might have heard about, was that we had a huge outbreak in our migrant worker dormitory. So that was another area that a lot of our young ophthalmologists, it was very inspiring and heartening to see them step up and volunteer to be in these areas, in these high-risk areas, to take care of these patients. So at that point, because all these activities have been disrupted, we felt that we needed to support our young ophthalmologists in providing this frontline COVID-19 support. So the first thing we did was to set up a WhatsApp group, similar to the APEC YO WhatsApp group that Diva Khan set up. We found that it was very useful for disseminating links to webinars. I think YOSI was one of the greatest contributors to the online education that our YOs benefited a lot from. That was one of the first things that we did. And then second, I think industry has been very supportive of our YO community in Singapore. And this time around, they were again very supportive in providing some help to our young ophthalmologists. So for example, Zeiss, when we approached them, they offered to provide each and every one of our young ophthalmologists goggles, because at that time there was a lot of fear about COVID-19 spreading through tears and through the conjunctiva. So they provided all of us a pair of goggles. And also Bayer, who wanted to support our YOs, distributed fruit packs to each and every one. I think these are small gestures that help to raise the spirits and make everyone feel like we are still a community, and the support of the community is still there. I think that's very important to make everyone realize that they are not alone in the fight against COVID. So I think with the gradual easing of the social distancing measures in Singapore, I think our lives have kind of mostly gone back to normal. So hopefully in the coming year, we can even meet up and do a social event or have a in-person seminar or symposium. Thank you.
Thank you, Murthy. And I'll come to Dr. Joy. So Dr. Joy, you recently had a very successful, run for the young ophthalmologists. And so what are the things that you keep in mind when you're, planning such a program or creating such a program?
First of all, I'd like to thank Diva Kant for being one of our wonderful speakers at our YO Symposium at our annual scientific meeting in December last year. He spoke to us about YOSI, its history, its activities, and it has always been very impressive, being probably the oldest YO society in the Asia Pacific region. I think actually, for YO Symposium, it's not the first year. In fact, we started in 2016, and it was since then we've had an annual meeting, an annual symposium specific for YOs at our annual scientific meeting. And being the organizer over the last few years, I think the most important thing is to remember what you need as a young ophthalmologist, especially as a trainee. I don't know how it works for other countries, but in Hong Kong, and I'm sure in many other scientific meetings, a lot of the topics are recent advances. researchers, unpublished data, the latest thing, the biggest thing, the hottest topic. But this is not necessarily the concern of a first-year trainee who is also a YO. And I think it's very important to remember their needs as well. So how we do a YO symposium is we always get trainees to be organizers. So they will help suggest topics. So they will know what they really want. So what we usually do, for example, we once invited examiners for our exit exams to tell us the examiner's perspective when they are seeing trainees go through exams, how they panic, what angers the examiners, which I think is an interesting, like, it's not something that you will, just go up to your trainer and ask them. You dare not, but we get them on stage and they tell us openly how they, how they mark you, what they don't like, so on and so forth. We also organize competitions like videos of, cataract complications, and we award them with things that might be useful. For example, personalized 20 diopter lenses that, trainees love. They may not essentially want to buy one themselves, but they might want to get it. Other things that we cover more this year, we invited Diva Khan to tell us about YOSI overseas. We invited some of our trainees who are currently overseas doing fellowship, which is not common in Hong Kong, but how they go through the process of application, so on and so forth. So I think these are topics that actually not necessarily a specialist want to know about, but trainees, these are what they concern. And most important, personally think success of YO symposium is the attendance by YO, and therefore you have to make topics that interest them. Thank you.
Great. Thank you so much, Joy, for that insight. Dr. Digvij, should we close the session? Because you already...
It was a wonderful session, Divakant. You can close the session with the closing remarks, and we can get Dr. Namrata ma'am to say something about her thought about how we collaborate with each other before we...
I think on behalf of everyone, we would like to welcome the President of the Ophthalmological Society, Professor Mahipal Sachdev, who's with us here. And we have other members of our governing council also joining in. I can see Dr. Barun Naik sir, the President-elect. I can see Dr. Santosh Unawar, the editor of Indian Journal of Ophthalmology, and I'm sure others are joining soon. I think it is a very good idea if YOSI, Digvijay, Devakant, Sonal Kalia, Karan Bhatia, all the others can get so many international people on this forum. It is high time you had a global YO network. It is high time you had a global YO forum. And I think all of you should get together, and that should be the way forward. It was an excellent program today, and it was really exciting and very inspiring to see how the young ophthalmologists all over the world, are coming together, are marching forward together. So all the best to all of you, and I think we can start the next session.
Thank you so much.
Is the inauguration, and we're thankful for the yes office bearers and Dr. Mahipal sir and everybody to be joining in. And I'll hand over the proceedings now to Devakant and Sonal for the inauguration.
Well, thank all our panelists for the last session. Thank you all for joining and all for the wonderful insights. Over to Dr. Sonal for the inauguration.
Good evening, everybody. It is my pleasure to be among distinguished ophthalmologists and enthusiastic beginners to this eagerly awaited annual event. The delay of the COVID could not stop us, and now we are here with a fusion of not just different subspecialties in ophthalmology, but of the art of learning leadership and growing in the field. Welcome to AIOS-YOSI Forum. Myself, Dr. Sonal Kalia, Vice President YOSI, and Secretary YOSI, Dr. Devakant Mishra, will be your hosts for the evening. Year after year, the roots grow deeper, and the experience of past bears sweeter fruit. This year, with kind blessings of AIOS, the team YOSI endeavors to bring to you the fusion of basics and the new frontiers touched by ophthalmology and YOs in the ever-expanding field. We are happy to share with you the amalgamation of the ideas And we would like to now invoke the blessings of the Almighty. And for doing that, I would ask you all to just know about a little about our Upanishads. So, Asto ma sadgame, tamso ma jyotirgame, mrityor martam game. Lead me from lie to truth. Lead me from darkness to light. Lead me from death to immortality. So these lines from the Upanishad sum up the Indian thought about knowledge in its true form, which liberates a man. And this symbolic lamp will begin this festival of knowledge in presence of the esteemed dignitaries. And what we have in store for you today evening is just the amalgamation of the year of events and this galaxy of stars that does not, need any introduction. And we would like to bring to you something from what all we have done throughout this pandemic. And I would want to now tell you the next program will be taken over by Dr. Divakant Mishra. Before that, I'm going to introduce to you the galaxy of stars that are present with us today evening. And we are very happy to share with you that the AIOS president has found time and he's here with us. He is a person who does not need any introduction, and he is somebody who was the founder of CFS in India, Dr. Mahipal Sajdev sir. We are thankful to you for coming up and joining our forum today. Next is our venerable faculty, Dr. Barun Kumar Naik sir, President-elect AIOS, Dr. Lalit Verma sir, Vice President AIOS, who is the stalwart of ER surgeries in India. Professor Namrata Sharma ma'am is not just All India Ophthalmic Society secretary, but a fountainhead of illuminating ideas. She has been inspiring all of us. Dr. Rajesh Sinha sir, treasurer AIOS, who was one of the forces behind the inception of YOSI in 2014. Dr. Partha Biswa sir, chairman scientific committee AIOS, is not here with us due to family engagements. Chairman ARC, Dr. Chitra ma'am, who is synonymous with innovations in ophthalmology. Dr. Arup Chakravarti sir, a voice of reason, who is also the editor of AIOS proceedings. The most enthusiastic VIO mentor, Professor Natarajan sir, who has always taken keen interest in uplifting YOSI. Now, instead of welcome to the dais, if all the dignitaries can just give a thumbs up sign to VIOs and show your support to us.
We also have Sonal, Dr. Santosh Onawar, who is the editor of Indian Journal of Ophthalmology.
Right, ma'am. Welcome, sir. Thank you so much, ma'am, for pointing that out. And over to Divakant to start the proceedings.
Thank you so much, Dr. Sonal. And I have the great honor of inviting Professor Dr. Mahipal Sajdev sir to give his opening remarks for this session.
Thank you very much. Good evening, everyone. Thank you, Devakant, Dr. Sonal, Digvijay, and other members of YOSI. It's always a pleasure being among youngsters because that actually brings out the exuberance of all of you that you have towards doing better and excelling in your profession. I have said this before, and I feel rather proud to see the youngsters in Indian ophthalmology really excelling. The depth of knowledge that you people have, but apart from that, I think it is the ideas that you people are getting, and that was showcased significantly in the innovation session. One thing that India lacks today is to make hypotheses and to come out with ideas as to what is the hypothesis and what is going to work. I think if the younger lot is able to marry the huge amount of clinical material that we have in India and come out with the really hypothesis and to change the way ophthalmology is done as to come out with solutions. That is the thing. You have to come out with what is a problem. You have to come out with what is the hypothesis as to how this problem is occurring and how do you solve it and come out with solutions. And these solutions need to be simple and they need to be applicable in majority of the patients of that particular type. I think that is something very, very important, that we need to put our mind and heart and soul apart from the clinical work into research activities and to get new breakthroughs in ophthalmology. There are several new things that are coming out of ophthalmology in India, but we have not been able to actually bring it to fruition in the sense that the world kind of accepts those new things. That is the challenge where you have to really come forward and excel. See, today you people have far greater knowledge in as regards computers, as regards technology. And mind you, as I see, as maybe 30, 40 years ago, people used to write that the world is flat. I would say that the world is digital is going to be the next mantra. A lot of things are going to go there are companies like Google, etc., who are investing a lot into artificial intelligence. And tomorrow you may be going to a mall to do your normal shopping and just getting an eye map done and a scan done for your retina, and an artificial intelligence telling you that, well, the person needs some intervention, the person has diabetic retinopathy or an anterior segment thing that can be done. So I think you guys are really, really placed at a pedestal which wasn't there long ago. But you are placed at a pedestal where tech, if you look at Bangalore, the other day I was reading, Bangalore is the maximum number of tech developments that is happening. So I think you guys should marry tech, and you guys should get the best out of ophthalmology and technology and give it to the patients and give it to the community. I think India is poised spectacularly as regards the wealth of patients that you have, because there are people who have contacted us for fundus photographs, etc., to put on their AI into proper perspective, etc., for diabetic retinopathy. There is so much of data that is available. Unfortunately, we are not collating the data or not keeping it together because we have not understood the wealth or the wealth of data, that is the power of data that you can create. So I would say that you should open your horizons. You should become more broad based. Get out of a tubular vision that people have in India as to just doing the same thing again and again. I think you need to invest into thoughts and ideas, because that is the most important thing. That thoughts and ideas is something that revolutionizes things and that make things easy. So friends, I would say that this particular symposium that you have done is a way to bring the mindset of young people together. It is a great effort that you are putting in, and collating the various young minds across the world, I think, would be the next big step, that you kind of do that and then share ideas and then form subgroups about various things, and go ahead and do the surgical load along with the clinical research, etc. As you all know, that India does, say, more cataracts than US, Europe, and China put together. So I think we should capitalize on all these things that you have. All the technology is available in India, and if you see, slowly there is n number of researches that are coming into India, which are being the only place where that research is being done by multinational companies. So friends, I think you should today bring out the best of the academic skills. The thought provocation is the most important thing that this society can do, that you make thought leaders amongst yourselves, and to also come out with ideas for scientific development. So I think great initiative. AIOS is always supportive of it, and I think as youngsters you should dream big. And until, of course, you start to dream big, you will never achieve anything. So the sky is the limit. I would say that for you people to kind of grow on, and our blessings and our help is always there. A mentorship, if you require, that can also be provided by all the members whom you think fit can give you mentorship. But keep up the momentum, keep up positive attitude, and I think I wish you all the very success in this endeavor that you have taken, and getting Indian ophthalmology, I would say, the pride of place that Indian ophthalmology deserves in the global arena. Thank you very much, and all the best.
Thank you so much, sir, for sharing your pearls of wisdom. It would be an honor for us if Dr. Varun Kumar Naik, sir, who's the president-elect AIOS, would share a few pearls of his wisdom as well with young ophthalmologists today.
Yeah, thank you. Thank you, Sonal, and thank you all the office bearers and the leaders in EOC. I'm really happy that EOC has means taken and moved forward quite a bit from the inception. And just something, just to add what Dr. Mahipal said just now, that it should not be just another society. It should not be that society should be doing just another whatever the others are doing. So it is just say like not just another conference, not just another programs, but you have to see that what is if something you are taking as some educational activity, then you should take what is the target which I am targeting at, because there can be no single program which can be targeted to all variety, because we have such a wide spectrum of audience amongst ophthalmologists. So you have to target small group, but then target it properly. So that is the first thing. Let's do something different, which Dr. Maipal also pointed out, that don't just keep on following, oh, now this program I will do instead of 5, I will do 10. Or I will do instead of one annual program, I will do one annual and one mid-year, something like that. So that is not going to serve any purpose, because just simply you will be, means I am a little crude in this and blunt in this, sorry, blunt, that it's just obliging more and more speakers and people. That's all. It's not going to serve any purpose. It doesn't serve any means aim. It doesn't serve any aim. And in that regard, what Dr. Mahipal said, just to take a little further, that he said that new ideas and all, because earlier I was editor for 6 years in IGO, and now being the editor for so many years in JCOR. And suddenly I have seen the mushroom growth of submission, and mainly in my journal also, in not my journal, Ms. JCOR, mainly because it has now it's been indexed and which is recognized by MCI. So DOAG. So then is people just simply want to write. They don't do properly. They don't even read how to write properly. So they have not even gone to the instructions. They have not followed any and research protocol and research, how the research are being done. And as he said that create some hypothesis, then try to everything will evolve around your hypothesis. So those things need a big training and boost from whichever aspect or whichever resources it can come, it should be. But it's little, I am really frustrated whenever I see any program which is related to research. Not many people come and attend enthusiastically. But everyone wants to write. So many people just simply give me a call and say, sir, now my this promotion is due and I have just sent one article. Now this is not the way for publication. And then if that is the thing which is, if everyone starts adopting and expecting, then probably it's only God can save that society and that community. So with this, I will not take too long. Just with this, at least I'm happy that new forum of young, because definitely the young people they all will come with new ideas, and you are basically future of Indian ophthalmology and ophthalmology by and large. So think something different. Think something, if someone who is something which has been done in past, if you're just doing that, but not also, I'm not telling that do something different for the sake of doing something different, but see the utility, that how much is the utility of this and what people expect, what people want. So with this, I think I'll just stop here. And I again congratulate you, and I congratulate and wish you all the best in future endeavors, and all the office bearers for taking so much effort and taking it further. So with this, thanks a lot for giving me this opportunity and inviting me.
Thank you so much, sir, for your words. Is Dr. Lalit Verma here with us? I think he has not been able to join. May I invite Professor Narmata Sharma ma'am to say a few words?
Thank you, Devakant. I have a very short presentation. In way back in 2018, when we did the first YOSI forum, we never realized that, it is going to get this big. And congratulations to you today that don't know why it is going on writing. Anyway, congratulations to you today that you have made it so big. And in 2018, we just thought that we would have young ophthalmologists with us because the idea was that all the other international societies did have a young ophthalmologist group. And that was the idea that we should also encourage the young ophthalmologists from our country. And we are very proud of our young colleagues who've done a great job. Uh, uh, we did the first one way back in 2018, and this was the pictures from there. The group was quite small at that time. Then there was innovations also, which were presented at 2019. The theme was that you all know it better than me. Then there were several of the AIOS-YOSI writing events which were held, which included AIOS-YOSI writing competition initiated by Dr. Natarajan and Dr. Sonal Kalia. And then we did have Yo pavilions at our annual conferences. And also we had webinars at the Institute of our President, Professor Mahipal Sachdev, to address the problem of those during the COVID times. And then this program today, which started, I think has done really very well in all the subspecialties, what is new. And I think this was the session to really, it was really an amazing session to get at least, I don't know the numbers, but I'm sure there are more than 20, societies from world over sharing their experiences, their tribulations, their achievements, the way they moved forward. And I think, again, tomorrow you have a great program related to career in ophthalmology as well as subspecialty. And I'm really proud of, in fact, all of us at the AIOS are proud of YOSI because you're not only guiding the YOS nationally, but networking with other YOS societies and guiding the YOS globally and leading all the way. So I said this and I say this again, that YOSI is infectious. It is infectious not only for us, it is infectious globally for everybody. And I do realize, and we all realize that we can help you. I feel the younger generation now has greater struggles than what we had when we were young. So we can only teach you by, our experience. But it goes without saying that, there is more competition now. There are more ophthalmologists now. The technology is becoming more and more expensive. So your struggles are far more than our struggles were at our own age. But we are all in it together, and with the governing council, who is so supportive of the young ophthalmologists of the country. On behalf of the entire governing council, I would like to congratulate you and would like to encourage you to, move forward from here. So thank you again for doing the program.
Thank you so much, ma'am. Without your support, this program would not have been possible, surely. Ma'am, next I would like to invite Professor Rajesh Sinha, sir, who, if I remember correctly, was one of the forces behind starting YOSI, and he nudged our, the person who started everything, Tarun Arora, and it was years ago in 2014 that the first DOS session had YOs involved in a great number, and then there was the YES session. So Professor Sinha, sir, if you could speak a few words to encourage us.
Thanks a lot, Sonal, and it's a matter of great pride for me because you all guys have taken YOSI to such a great level, and I really feel proud of you. I agree that, it started way back in 2013, 2014 when, Tarun, Vijay, we all sat together and this concept started, and the first YO Times also, I remember when it was published. And I mean, from that time to now, what you have done today, I mean, you are really, taking this to a much, much higher level, and things are moving in the right direction. So that's a matter of, it's a great thing, I would say, and it's all because of efforts that you all have put in. So that is the reason why I feel proud, because you all guys are very hardworking, very good in your work. So, that's how you are taking it to the next level. And I completely agree with the earlier, Dr. Mahipal, Dr. Nayak, Dr. Namta, all they have said that, you have.
एक बार ज्वाइन कर लूंगा करण को दिखाने के लिए. उसने बोला हमारा YouTube का अवार्ड अनाउंस करेगा. I want So you do think differently. That's very true. So I mean, that's how things have changed so much. So once again, many congratulations. And whenever you people need any help, like I know Digvijay, Devakant, Sonal, you all are, Karan, you all are very hardworking and very good in your work. But whenever you need any help, I'm always there for you. Thank you. Congratulations.
So when the treasurer of AIOS says that when you need any help, call us, what more do we want today evening? So next I would like to invite Dr. Santosh Honavar sir, the editor IGO, and if he's here, it would be so nice to give some pearls for publication to all of us.
Santosh was very much here.
He's just logged out. I'm back.
Okay. So next, if I would request Dr. Chitra ma'am, Chairperson, Academic Research Committee, AIOS, to share her wisdom with us. She's synonymous with innovations, and we'll be really happy to hear from you, ma'am.
First and foremost, congratulations for where you are, all of you today. And I think you all have positioned yourself so optimally. Like I realize it's not just a forum where you're academically sharing. I think you all are a forum where you support your colleagues also to evolve and grow and probably even guide them in their career growth, sharing your individual experiences. So I would say that the way you stand, that you are definitely going to evolve with the changing needs of the hour as it comes on, as so beautifully Dr. Mahipal and Dr. Barun and Namrata had said. So my wishes for you all that you break newer and stronger frontiers and become an organization which has to be envied and emulated all over the place. And my prayers and best wishes for you. Thank you.
Thank you so much, ma'am. And next, if Dr. Arup Chakravarti sir is here with us, he's the editor proceedings AIOS, and we were hoping that sir could join us to share his wisdom.
I think he's not joined.
Yeah,
So he's not joined.
Devakant to start the official proceedings.
Professor Natarajan, I think he's also hasn't joined yet. So next we'll invite Dr. Digvijay Singh. He's the present president of YOSI to give his president's remarks.
Thank you, Devakant, and thank you to all the AIOS Governing Council for encouraging us. I'll keep the address short so that we have time for the more exciting YO awards that are going to come up after this. It gives me great pleasure to deliver the presidential address at the 3rd annual AIOS-YOSI meet at this virtual forum. In my last address at the 2nd annual AIOS meet in 2019, for which Professor Namrata had just shown the pictures, I had not envisioned that I'd be giving an address on a virtual platform to an audience as large as we have today. At the outset, I would like to express my gratitude to all of you for joining us from across the country and across the globe. In fact, we've had, like we said, more than 20 countries who have participated in this event. I would like to express my gratitude to the AIOS office bearers, Dr. Mahipal Sasdev sir, Dr. Barun Naik sir, Dr. Lalit Verma, Dr. Namrata ma'am, Dr. Natarajan sir, Dr. Professor Rajesh Sinha sir, Dr. Partha Bishwas, Dr. Chitra Ramamurthy, and Dr. Santosh Honavar sir, and Dr. Arup Chakravarti for all their encouragement throughout and for always supporting us and the forum that is here. YOSI has come a long way from its inception to a body comprising some of the brightest young minds of the country and the future of ophthalmology in it. From a society of a few hundred to nearly 1,000 young ophthalmologists, nearly 1,000 members now, YOSI has grown in the last year or so since the last AIOS-YOSI meet. Undoubtedly, it has grown with the mentorship of our seniors and a multitude of opportunities provided by them. The past year has given us an unprecedented challenge, and to all the ophthalmologists, particularly the young ophthalmologists and those in training. It has impacted their training process, their career opportunities, and their academic opportunities overall. Nevertheless, all of us have fared through these rough times and are coming out stronger. The means of learning has changed, but the will to learn is stronger than before, and the will to thrive is stronger still. As a society, YOSI has strived to provide support to all its members through disseminating information, providing learning opportunities, and preparing content which is tailor-made for our requirements. We have grown in stature both within the country and globally to become a society which is recognized for its excellent work and collaborative efforts. And while we shouldn't really be patting our backs, and there's a long way to go, it has happened with the support of all the seniors. Various activities have been undertaken by this society in the past year, including the Yo Pavilion at the annual AIOS conference in Gurgaon in 2020, a multitude of webinars, publication of few issues of Yo Times, production of YouTube videos, addition of more of Yo flash notes, start of Yo slides, production of Surfing the Anterior Segment series, the Late Night Retina series, and the Yes or the Yo Examination series. We've established international collaborations and joint sessions, and we've strengthened the Yo Fellowship Help Desk, as well as had a new YOSI Jobs portal, to name a few. The Secretary Devakant will provide more details on our activities through the year. I am certain that we will continue to strive to take YOSI from strength to strength with all your support. Whether it comes to delivering an academic and research, or in supporting the young ophthalmologists to make training and career choices, or in connecting them with appropriate mentors, or in helping them network with each other, YOSI will always be geared to providing the backing you need from us and from all your peers and seniors. For this, we continue to seek the support and blessings of our seniors in the AIOS and the academic institutions across the country. In the end, on behalf of YOSI Executive, I seek your blessings and confidence as we strive harder to make YOSI the best Yo society there is. Thank you. Over to you, Devakant.
So much, sir. I'll quickly go through the work that we've been able to do in the past year. And yeah. Okay. I'll be talking about what YOSI has been able to do in this year. And I saw this cover page where it said that it's amongst the 5 worst years for mankind yet. So let's see how good or bad it has been for YOSI. So it started with a bang, and we had a hugely successful Yo Pavilion at YOSI with tremendous support from all our seniors, and we had packed halls, and the sessions were very much appreciated by everyone. And then we organized the Global Yo session in Singapore, and with the help of the Singapore Yo Society and other Yo societies in the world. And it was hugely successful and well participated. But we didn't know that that will be the last meeting for us for the year. And we had so much planned. But we quickly shifted our gears, and the webinars were the thing. Dr. Apurva will be talking about them in detail, how we have been. So we did various webinars with AIOS, and the last one with AIOS was hugely successful, with over 5,000 young ophthalmologists joining and sharing their issues with the seniors there. We started the Late Night Retina. Dr. Avnish will be discussing in detail about that. Similarly, we started a recurring event, Surfing the Anterior Segment. Dr. Aarti will be talking about it soon. What we realized that the jobs will be, a lot of people were losing jobs and finding it difficult to find new ones. So we started the YOSI job portal, and we have listed over 50 jobs there, and a lot of young ophthalmologists have been able to find some jobs because of this portal. Similarly, the fellowship help desk, during this period, it evolved even further, and not just about fellowship, and people started reaching out to us for their personal problems and how they have been affected by COVID. So it became a really good tool in our hands, how we could help young ophthalmologists through this portal. Then residents were facing a lot of issues in terms of academics and training. So we started the residents network, and around 2,000 residents have joined this network, where we regularly conduct CMEs. And again, Dr. Apura will be taking them up, and the YES series, the virtual exam simulator series. We started the Yo slides, and Dr. Nilesh will be talking about it soon. Then we collaborated with Dr. Sen Gupta's Research Academy to give out some research fellowships so that people can start learning about research online. uh, during this time, we were also able to form the West Bengal YOSI state chapter, and we'll be discussing about this also in the course of the meeting. Coming to international meeting, it was really a wonderful opportunity for us to interact with a lot of young ophthalmologists, which was previously only possible through physical meetings. And the big news for us was that we became members of the ICO, and then ICO gave us the opportunity to conduct the first Global YO Colloquium at the WOC 2020. Then with new and old societies, with the power of these online meetings, we were able to collaborate with various young societies, and we were invited by many of them to be part of their sessions. Then we thought that we needed a supranational organization also in the Asia Pacific. So we reached out to almost 20 countries in Asia Pacific, and we brought them together, and we are working on to build a platform for them. We became a part of the APO-YO, and we were able to take out 2 newsletters. One was on the COVID scene in the Asia Pacific, and the recent one was on the status of training programs. So people are in the Asia Pacific finding it really useful. Then the other YO societies invited us to be part of this Hong Kong YO Society. And
Dakshineshwar.
Mute Dr. Can you mute?
One second.
Yes.
Yeah, and Dr. Apurva represented us in the LATAM Youth League Retina as well. We participated in the Korean Ophthalmic Society YO session, and there was a lot of participation from Indian presenters virtually, and Dr. Sahil and Dr. Tarjani won the best papers there and won some cash rewards as well. We collaborated hugely with the newly formed Bangladesh Ophthalmic Society, and they involved us in their various meetings throughout this season. So as the vaccine in the picture, and hopefully we'll be having physical sessions soon. So look forward to a great 2021. Thank you so much.
A captain is only as good as his team. And YOSI is blessed to have 2 great captains in form of our president, Dr. Digvijay Singh, and Dr. Divakant Mishra, who, whatever the kind of team that we have built across, like, they are 2 problem solvers, and they enhance whatever strengths that the team members have, and they, help the people grow despite their shortcomings. Before the academic in charges report, I think Dr. Natarajan sir has joined us. If you would like to say a few words to encourage the young ophthalmologists. I think he was here a few minutes ago. It's not there. So Purva, would you like to share the academic in charges report?
Sure. So it's an honor to be presenting the academic report for the year. So after the pandemic and we were in lockdown, there were webinars galore. Can you hear me? Yes. So since there were webinars galore, it wasn't long before YOSI also got on the bandwagon. And one of the earliest webinars we conducted was the toolkit for the young ophthalmologists, where many young ophthalmologists came together and spoke on how the YOs are also on the front line, how their experiences, their precautions, their safety tips. Then there was online resources for ophthalmic education, since digital was the way to go right now, increasing your online presence, and also whether a practice can flourish even during a lockdown. So after this was the Sitapur Eye Hospital in association with YOSI, the chronicles of PG exams under the able leadership of Karan, where important cases were discussed and approach to each exam case was discussed. Next up was the international exams webinar, where important exams like the FRCS, FRC Oft, FICO, FAICO were discussed. And there were stalwarts like Dr. Meenakshi Swaminathan, Dr. Devendra Venkatramani, Dr. Rashmin Gandhi, and Dr. Akshay Nair. then was the mega quiz by YOSI, which was in the May of this year, and it was under the leadership of Divakant, Sonal, and Dr. Digvijay. Here, the quiz went from prelims to semifinals to finals, and these are the winners of the mega quiz that we had in May. Of course, the star of all webinars was AIOS-YOSI, the webinar that these two societies had in association, and it had more than 5,000 engagements, and this was where we selected about 15 question entries from young ophthalmologists across India, and the chosen questions were posed for the mentors to answer, and the mentors comprised of the leadership of AIOS. So, of course, like Divakant was saying, we had the YOSI Residents Network CME series. There are more than 2,000 residents right now in the Residents Network. And it was in September 2020 that we had two of these CME series. One was on starting phacoemulsification, and the other was ocular trauma primer. Both in both Dr. Karan and Dr. Sonal have taken leadership. Between Sen Gupta Research Academy and YOSI, and this also had a pre-test and a post-test sort of where there was a quiz that had to be answered, and the top three winners of the quiz were given the Sen Gupta Research Academy fellowships at a discounted price, which is very useful for young ophthalmologists since it involves a lot of learning of biostatistics, literature review, and manuscript writing. It also had the final also had highlights about biostatistics can be simplified, about selecting a research topic, and tips to avoid plagiarism. There are recurring
वेरी गुड और गर्दन ऐसे सीधा रखिए स्ट्रेट स्ट्रेट
Can we mute
इधर देखिए यहाँ पे
everybody except for Apurva?
So there are recurring episodes such as the late night Retina episodes, which have had 4 seasons already. There have been 16 episodes, 33 presentations, 25 presenters, and 14 total panelists in the entire 16 episodes. There are 12 core members in this committee, and each week each month, twice in a month, we solicit cases from across India, and the best cases are chosen for presentation and discussion. Of course, there's the YO slides under the leadership of Dr. Nilesh, where there are curated PowerPoint presentations and a PDF handout for exam topics. And like Dr. Nilesh will tell us, most of the exam questions in 2020, I think 70% were from the topics that were covered in YO slides. Then there is the surfing the anterior segment sessions, which have interesting cases. We had Steven Johnson syndrome, we had bleb revision, etc. As cases, and Dr. Aarti will be telling us more about it. Then we have the exam simulator series, where important cases kept in the exam will be discussed, and this is special because these have examiners who are not very senior. It is mostly people who have been in the YOSI itself. Even the examiners are not very old, they are young ophthalmologists. So it provides a new perspective for the examinee to understand what is the latest as well as what will be asked in the exam. So finally, I would like to say that the academic aims of YOSI are the most important and they are paramount. We want to have a wider outreach. We want to have high quality ophthalmic educational resources. We want to have wider representation, which we feel is very important, and we want to provide the stage for more and more talent. So thank you. Over to you, Divakant.
Thank you, Dr. Apurva, and I would take the opportunity to acknowledge her role on the academic front and leading us there. Dr. Sonal, let's have the next.
Requesting the VIO award to be, shared by the Secretary, Dr. Divakant Mishra.
Apurva, can you stop sharing so that?
Yeah.
An excellent initiative by Dr. Divakant to choose AIOS-YOSI award, and he'll share the details of how the process was taken shape.
Okay, thank you so much. So last year we started the YOSI Young Ophthalmologist Award, and we thought there was this thing that was missing, where we can recognize young talents and award them. And we kept it pretty simple. What we did was that we asked people to send in their achievements, and we looked at 5 things. This year, of course, we have 2 categories. One is less than equal to 35 years or more than 35 years. And we look at things like publications, presentations, awards, innovations, and the leadership positions that a person has held. And we simply give certain, like publications and awards have the maximum marks, and presentations have lesser, and innovations and leadership similarly have points. And the person having the maximum points wins that award for the year. And of course, the person cannot apply for the award again. So this eliminates any form of bias or anything, and it's a simple mathematical calculation for this. So I have the great honor of announcing this year's award. So the category less than 35 years, we have someone who has 189 publications, 17 presentations, 20 awards, 3 innovations, and leadership positions. And we have Dr. Kaushik Tripathi, and he is consultant in charge at ASG Hospital, Kolkata.
Devakant, can you reduce the volume a little bit of the music?
I'll just delete that. Yeah. So sorry for that. And so the award winner for the lesser than 35 years age is Dr. Kaushik Tripathi. Are you there, Dr. Kaushik?
I saw him. He was very much there. Yes, very much.
And may I request Professor Mahipal sir to kindly say a few words of encouragement for Dr. Kaushik. And then Dr. Kaushik can talk about and inspire us as well.
Congratulations, Kaushik. I think that's phenomenal. Having 189 publications, I think that leaves most of us hollow. But I think it's great. I've had the opportunity of working with us for some time, but I think he's a great clinician, a great person, and obviously a great researcher. So congratulations, Kaushik, and keep up the good work. All the very best.
Thank you.
Dr. Kaushik, we would like to hear from you about your journey so far.
Actually, when Dr. Tarun Arora and Dr. Digvijay and Rajesh sir started YOSI, I was there in RP Center, and actually it was a very good thing, and we the change of YOSI from there to today is actually outstanding, and actually so many young ophthalmologists are getting involved in YOSI work, and it is actually exploring all the avenues to help young ophthalmologists. That is the best thing about leadership, and also the leadership, current leadership is also allowing people from every aspect to join and give their inputs to improve the YOSI at overall. That is the good thing, and I think with this, with involvement of all people, will definitely reach greater heights. And thank you. And I have been recently associated with your slides, and will try to improve your slides under the very adept leadership of Dr. Nilesh Kumar. Thank you. Thank you for the opportunity.
Thank you so much, Dr. Kaushik, and congratulations again.
Well done.
Okay. So for the next category, that is over 35 years of age, we have someone who has 130 publications, over 135 presentations, 21 awards, few innovations, and leadership positions to his credit. And he's deeply involved in all YOSI activities. That's another thing that we look at. And I have the great honor of announcing the result, Dr. Akshay Nair. Are you there, Dr. Nair?
Yes, I'm here.
And Dr. Namrata ma'am, can we have some words from you?
So congratulations, Akshay. We've known Akshay for such a long time now, very actively involved in research and publications. I remember I told him to do the trauma guidelines and he did it overnight. So that is the dedication and that is the speed with which he works. Little interaction that I've had with him, I know that he's hyper efficient and keep up the good work, Akshay. I know he's also into virtual teaching tools, and I'm sure the project that he's taken up on the virtual teaching tools is also going to benefit not only the ophthalmologists but also the young ophthalmologists.
Thank you, ma'am. Thank you so much.
Congratulations.
Congratulations.
Dr. Akshay, we would like to hear from you, and maybe you can inspire the young ophthalmologist how they can emulate you and probably be like you.
Thanks, Devakant. Next, as a rule, please inform future awardees that they are winning, so they are not dressed in a t-shirt. But jokes aside, I think this is a great initiative that YOSI has taken, because appreciation from the peers is the best form of encouragement for anyone at any level of training, whether they're a resident, a fellow, or a consultant. And I think anyone in my place probably would have, I was just lucky enough to have the right mentors at the right place, right from my residency where, Dr. Meenakshi and Dr. Ashwin were there, and in fellowship, I had Dr. Swati, Javed, and Dr. Santosh Honavar. And now even when I've come back to Bombay, in the hospitals where I work, I have Dr. Natarajan and Dr. Vandana Jain. Having positive people around you who encourage you to do well creates that circle of always improving yourself. So, and Dr. Namrata, actually, we informally were discussing something, and the thing that she said in the previous session of not letting a paper sit on your desk for more than 48 hours, at her level, if she's able to put that into practice, I see no reason why we shouldn't be able to do that, as young ophthalmologists. So I thank you for this opportunity and this honor. Thanks.
Congratulations, Akshay. Yeah, well done, indeed.
Can we now have Dr. Avnish with his presentation of the best YO flash notes?
Am I audible?
Yes, you are.
Yeah, I'll start sharing my screen. One second, I'll just... Is my screen audible? Is my screen seen?
Yes, we can see.
So I'll just... Yeah. So actually, flash notes, it's more than 2 years that we started with, and this was a humble idea that we can have just a page of notes where we can actually put in some ophthalmic conditions on. And this is where we actually are right now. We have 40 flash notes in total. And for this last 1 year, we have had slightly less flash notes, but then again, we have around 2,200 odd followers on your flash notes page on Facebook. And this was the last flash note which you can see, which we have had. I think this is the 39th. We had the 40th one as well. And here you can see that we have had people around 16,000 odd people we have had a reach of around 16,000 odd people. So these are some of our reviewers, and as Dr. Akshay Nair is here, and he is one of the mentors here who does continuous guiding and takes us forward. And I would also want to mention about Dr. Aparna Naik and Dr. Chintan Desai. They have been the co-editors, and we have been bringing in the flash notes as and when required. These are some of the flash notes which were there published last 3 years for the last year. And coming to the what next we want to do with the flash notes, we as a team, I would say that we would want to reboot, and seeing the success of your slides, I think we do have a very good platform, and I would want the younger people to do chip in, and we should be able to get in more flash notes this year around. And this is the communications which you can come across, your flash notes at Gmail and on Facebook page. So the first winner is Dr. Shishir Varghese. He's presently the consultant at Arvind Eye Hospital, Coimbatore. And we have a tie between the second, we have Dr. Gunjan Budhiraja. She is a cornea fellow at the prestigious Shroff Charity Eye Hospital in New Delhi. And we have Dr. Akshay Nayak. He is presently a fellow IOL at Shankara Eye Hospital, Bangalore. So congratulations to the winners, and we would want Dr. Shishir Varghese, if he's around, if he can, and followed by Dr. Gunjan and Dr. Akshay to have some words. Thank you. And we can be can Dr. Shishir talk about it?
Yeah, thank you, Dr. Avnish, and all the YOSI panel for choosing me. Actually, during this lockdown time, I just wanted to do something and contribute something. I was quite enthusiastic, especially for make it something simple for the PGs. So that's why I made some 2-3 more flash notes, but unfortunately did not find the time to contribute, but I definitely will be doing so some more. And once again, I would like to thank everybody for this award. Yeah, thank you, Avnish. Back to you.
Dr. Gunjan, if you're here, please, can you say something? Dr. Gunjan?
Thank you, everyone. And this flash note is actually helped a lot of postgraduate students, because there are some topics which are not nicely covered, and even if they are covered, they have a scattered distribution. So I think these flash notes are high quality documents to read from for all the postgraduates. Yeah, thanks a lot for the appreciation.
Dr. Akshay, if you can say some words.
Yeah, good evening, everyone. Thank you for really appreciating my flash note. It really encourages and motivates me to contribute to not just to YOSI, but to AIOS further. So really thank you, and really hope that it has helped a lot of people. Yeah, thank you. Thank you so much for this opportunity.
Thank you, Dr. Akshay. Can Dr. Rajesh sir can speak a word of encouragement for the younger people as to how we can have something like flash notes which can come in handy in their day-to-day work. Dr. Rajesh sir, if you can give some words of encouragement. Dr. Rajesh sir? We can ask Dr. Chitra ma'am. I think Dr. Chitra ma'am also has a snippet which comes weekly on Saturdays, which we get mails from. So if ma'am, if you can give us some feedbacks and how to go about with it. Ma'am.
I realize that it's a wonderful idea, and that you are doing so well. I just saw one snippet of one flash note, and I know there's so much learning which comes from it. It rather encourages each one of you or us, all of us, to be more innovative and think out of the box or put something forward. And I'm sure it'll catch on, and a lot more people will contribute as time goes on. It's a great initiative. Congratulations.
Thank you so much, ma'am. Thank you again, Dr. Devakant, for this platform, and over to you. And congratulations to the winners again. Thank you.
Yes, Dr. Sonal, we can have the next.
Yeah, so it's my proud privilege to invite dear friend Dr. Karan Bhatia, who will be telling us about the YOTube Awards. An excellent initiative, and congratulations, Karan, for starting it and for leading it to this point.
Thank you, Sonal. So I'll try to cut it short. YOTube is the official YouTube channel of the Young Ophthalmology Society of India. This is the core YouTube team where I am the editor-in-chief. Devakant is the joint editor. Pranav and Nikunj, they are the assistant editors, and they have been the backbone behind why YouTube has been doing so well, because without them, it could get difficult, to manage so many video submissions and editing and everything. These two guys have been taken care of, and the new leadership is actually of Pranav and Nikunj, who have been handling it, really. So we have section editors as well. Dr. Aditi Ghosh is taking care of cornea, Dr. Bharat Gurnani for ocular trauma, Dr. Nandini Chandak for refractive surgery, Pranav is again for cataract, Dr. Aarti Heda for glaucoma, Dr. Kirandeep Kaur for pediatric ophthalmology and strabismus, Dr. Chavir Singh Bindra for neuro-ophthalmology and retina, Dr. Samiksha Agarwal for retina and uvea, Dr. Rituja Thomas Grover for orbit and oculoplasty, and Dr. Ashish Ahuda for AIOS and technology. So this core team works a lot together, and the process is it goes through a proper review like you would have in any journal, and only then do we publish it onto our channel. So what is YouTube actually? It is it was initially launched, the first video on September 26, 2018, and it aimed to be the preferred medium of video assisted ophthalmic education and training for ophthalmologists all over the world. We wanted it to be a platform for AIOS to showcase their talent and reach out, help them provide a medium by which they could reach out to the masses. So who can submit these videos? You have to be a YOSI member. The first author has to be a YOSI member. The seniors cannot submit videos if the author is not a YOSI member. So we have various categories. We have the demonstrative categories. Now, this demonstrative categories are ultra short videos, which are about less than 30 seconds, and they include findings of, important findings of small procedures like a Schirmer's test, or you're seeing a Munson sign over in this video. We have some instructive videos. So these include videos which teach everything that there is about an examination procedure. In this case, we are talking about topography over here, but you could discuss, application tonometry, gonioscopy, and they are basically aimed at discussing the procedure in a stepwise manner and may not or may not include the whole case. We've got clinical examination cases, and these videos generally aim to educate a postgraduate or a fellow on the proper methodology of examining a case. And it's very helpful, for them final year students as a brush up for their exams. We have various surgical videos. These are the two videos that came first for the last year's annual YouTube award by Dr. Praveen Dhanapal and Dr. Akshay Nair. And this basically, the stress is on important and basic steps required to learn about the procedure. We wouldn't want to focus on complex procedures as much, but you would want to prefer, basic videos by which the YOS are basically of residents, fellows, and other fellow young ophthalmologists, but they are all learning. So these videos basically teach them how they can go forward and replicate that same videos, the same surgeries in their own setting. We have interesting or rare cases. Now this title is explanatory, self-explanatory. We've got YOS and technology videos, and this Ashish Ahuja particularly takes care of this. We've got various interviews that we have, and this is by eminent personalities. This was by our own AIOS president, Dr. Mahipal Sachdev, the entrepreneur and the clinician. And this is not for submission. This is at the discretion of the editorial team. We have various guest lectures as well, and these are also not for submissions. We have videos on patient education as well. We have conference presentations as well, as this video on international examinations by Dr. Devendra Venkatrami is pretty popular. We have other videos like this video of making an Excel sheet by Dr. Sengupta. This is what our channel looks like, and we have around 3.17K subscribers at present, and we try to cover our webinars also and then submit videos. We encourage a lot of people to submit. So you can see there's a lot of videos that are there. So this was the last year that we had the award. Dr. Akshay Nair and Dr. Praveen Dhanapal won the award. So this year we also had for 2021 instead of 2022 because the conference got a little bit delayed. So the judges that we had over here, there's a definite criteria by which the judges had judged them. There was the video quality, the sound quality, the content, the editing, the originality or the innovation aspect, and also the teaching value of the video. So we had Dr. Saurabh Pathwardhan, the first judge, who basically is a cataract, retina, and refractive and glaucoma surgeon, and also the medical director of Nandadeep Eye Hospital, Sangli. He's got a very popular YouTube channel and also a website known as phacotraining.org.in, and he's got excellent teaching ophthalmic videos. We have Dr. Akshay Nair. Dr. Akshay Nair is a YOSI executive member. He just won the annual YO award as well. He's an ophthalmic plastic and ocular oncologist, surgeon practicing in Mumbai. He's an AO instructor and has got a very popular YouTube channel as well, particularly featuring videos on orbit and oculoplasty. We have Dr. Piyush Bansal, third judge, who is the director of the Bansal Eye Institute and Super Speciality and Comprehensive Eye Hospitals in Pune. He's a consultant ophthalmologist and a VR surgeon at other hospitals in Pune. He's academically also involved in various ophthalmic and vitreoretinal societies, and a good, he's also a YO member, and all of these three are YOSI members, and they are an example to the younger YOs. So these were our judges, and the video that we had was the best video was won by Dr. Mritika Sen, Journey to the Center of the Tumor. Dr. Mritika is a product of the RP Center AIMS. She's currently doing her fellowship in ophthalmic plastic surgery and ocular oncology under the legendary surgeon, Dr. Santosh Honawar. Mritika, are you there?
Yes, I'm there.
Can you please say a few words? How is the feeling, and how did you make the video, and what was the process, and the thinking process and everything that there is to it?
All right. First of all, I would just like to thank YOSI for this wonderful, wonderful platform. And I was really excited to see the video on YouTube. So thank you very much for this recognition. And I would like to thank Center for Sight, Professor Mahipal Sachdev, and all my mentors there. And of course, Dr. Kaustubh Mulle for all his help, Mr. Shiva and Pradeep for their help with the video. And of course, my mentor, Dr. Santosh Honawar, for always giving the opportunity and always encouraging creativity. So this was not a surgical video. This was a video about the importance of ocular pathology. And I think this is a topic which all ophthalmologists should be aware of the scope as well as its importance and how to send the specimen, when to send. So this was about that. And it's about a story, it's a story of a tumor and how it was finally diagnosed. So yeah, that's it. Thank you.
Thank you so much, Mritika. Dr. Rajesh Sinha sir is here with us. Sir, can you please say a couple of words of encouragement for Mritika and the other YOs out there?
Well, Mritika has been a very good student of mine. Very, she was quite close to me, and I know her talent. She is very talented. So yes, and of course now she's working with Dr. Santosh and getting all the training. So many congratulations, Mritika. And
thank you, sir.
I know most of you are very talented. Most of the YOs are very talented, very tech savvy also, and you all can do such things and win many awards world over, not only here, but world over. So all the best to all of you, and do good. Keep the good work, keep doing the good work, and keep the flag high of Indian ophthalmology abroad as well as, amongst your peers.
Thank you so much, sir.
Thank you so much, sir. Thank you, Mritika. So I would encourage everybody to, submit your videos to YouTube. Thank you so much.
Dr. Natarajan sir is here. We are thankful to you, sir, for giving your valuable time to us. If you can just share some pearls of wisdom with the young ophthalmologist today.
Sure. Thank you. And I'm happy to be associated with the Young Ophthalmic Society of India. And I wanted to say I'm working from 2016, I think, right? We started awards in IGO editor. And I think I'm happy. I also want to tell, I know the winners are here. Yesterday I had a webinar with Devi Shetty. And the topic was how to overcome failures. So I think the award winner, congratulations to all the award winners and whoever, but I want to address this to the people who have not got the awards. And I think Namrata is here. I lost the Colonel Rangachari against her in 91, I think. That's all right. And then after that, so many awards I won, but I think, and there are so many awards you apply and you don't get, and doesn't mean that you are not worth it. So that's what I wanted to convey. Devi Shetty said he failed FRCS 3 times. And and then you know what all he has done. And I think luckily I have not failed, but what I want to say is that anyway, there's no luck. And this is what I learned from Dr. Badrinath, and my other mentor is Swami Vivekananda, which is what I'm doing more now. So he says 99% work with passion. There's no question of hard work. If you work with passion, I saw the video by Mritika Sen. I think thanks to Santosh for training her, making her think. And I think the good teacher is how to make a person think. And I think that's what Santosh has done. Great job, Santosh. And I think I should congratulate you for the award by Mritika Sen. And some people like Akshay, even though he's working with me, but I think he's on his own great. And I think many of you are having a lot of creative ideas. And every day I want people to have creative idea. Sometimes you look stupid, doesn't matter, but you tell somebody will take the idea. So I think whoever did not get the award does not mean you have failed. And I think Thomas Alva Edison, that's what he quoted. He also said that you know how not to make a bulb by 999 times. So getting getting an award is not a problem. But I think whenever you have to appreciate yourself apart from the peers appreciating. I can see Anu very keenly watching me. So hi Anu. So thank you, and thanks to Sonal, Digvijay, and all of you, Karan and Devakant, and thanks to Akshay for reminding me. After a long time I started traveling again. I'm in Calcutta, so I forgot. Sorry for that, and I have to go for another program. And I see Chitra also. Hi Chitra. So anyway, I'm glad to thank to Digvijay and Devakant and Sonal and Upadhyaya for doing, and Sonal and so for the program on 19th for my 94th birth anniversary of my father. Thanks a lot. And Rohit Shetty is the keynote speaker, and I'm going to speak, and hope all of you can join. If you have any questions to me, I can answer, but otherwise, Devakant, then I'll catch up with all of you sometime.
Thank you, sir. Thank you.
Thank you so much, sir.
Thank you, sir.
Thank you.
I would request Santosh Honawar, sir, to also say a few words with respect to Mritika. First one teacher, Dr. Rajesh Sinha, said it. The second teacher now, Santosh Honawar, sir, should also say a few words as to how you felt.
I think it feels great always when your student wins something. She's extremely good, passionate. I think the most important quality about her is that she's extremely hardworking and passionate. And that's what sets her apart from others. And whatever she takes on, she does a great job. She doesn't stop at mediocrity, and I think she always excels. So I think that's what you would look for in any fellow or a resident. So I think she fulfills all the criteria of being an ideal fellow. She's been the longest fellow with me. Because of COVID, she couldn't go for her international fellowship yet. So she set a record already. Thank you, Mritika, for making me proud.
You've done a great job.
Thank you, sir.
Mritika, I think when you work with the passion, it's not a hard work. So that's what I want to change the Oxford Dictionary also, Santosh. There's no question of hard work. When all of us enjoy working, there's no hard work. I think it's work with passion. Great job, Santosh. Long time, yeah. I didn't see you for some time.
Hibernating.
And Namrata is there. No. We have to work on the AIOS Constitution reforms. I've sent my things to advocate, and we want the Young Ophthalmic Society to be active. Rajesh is keenly watching.
I wish we had something like YOSI when we were young.
Very true.
Actually, what's her name? Amar's sister. She started it. Somehow they put it down.
Yeah, Sunita started it. But
Sunita started it in 87.
Yeah.
But I think it went down. Nobody appreciated her.
Dr. Santosh, Professor Natarajan will change YOSI rules to show that he is still young and he'll become a member. And then he'll become the president.
This is probably the only society he's not a member of. He's even a member of, state societies all over India.
So I'm a LOC of OSWB.
Yes, you are.
I'm 30 years OSWB member, life member.
Sonal, can we have the next?
Yeah, we would like to invite Dr. Nilesh for the VIO slides presentation awards.
Thank you so much, ma'am. I'll just share my screen.
I wish to tell you that Dr. Nilesh is an innovator. He's the person behind Digs Pro, and now he's the person behind VIO slides as well. Congratulations, Nilesh, for the excellent job.
Thank you so much, ma'am. So I would like to thank first the YOSI Governing Council for allowing us to start your slides. This is the newest, I think, one of the newest initiative that started this year during pandemic. And this is how it started. One night in the lockdown, I was frustrated seeing all the poor quality of slides on SlideShare. So I just messaged Devakan sir that I want to start something that has to go through YOSI, and I want to start a presentation initiative. And it just took 4 messages from my side and 4 messages from his side to just get it going. And within 2 weeks, we had a group formed. And thanks to Dr. Apurva ma'am for giving the idea of handout, and Dr. Pranesh also for helping us during the initial stage to kickstart the YO slides. So this is how it started. We aimed for curated keynote presentation with moderated. Every slide has been reviewed, content with scientific accuracy. The presenter will learn to make impactful presentation and a chance to present in a webinar that happened later on. And to our surprise also, 70 marks worth of questions were in the last DNB exam. Out of 400, it was 70 during just 5 months. So that showed the power of curated content. And then we had a launch of our website in the Diwali, and it has been being updated regularly. And in the end of the year, we had around 5 months. We published around 20 curated and reviewed presentation, which has around 3,000 plus accesses and a dedicated portal. And this year, we formed the new core team that will be taking it forward. So that core team is Dr. Ankita, Dr. Abdul, Dr. Ayushi, Dr. Anupam, Dr. Muskan Bansal, Dr. Neelam Khatwani Arora, Dr. Kaushik Tripathi, who is the recent winner of Young Ophthalmologist Award, Dr. Rakhi D'Cruz, and myself, Dr. Nilesh. And New Year calls for new initiatives. So we responded to the call of AIOS for January is a Glaucoma Awareness month. So from this month, we are going to publish the presentations on public education. And we have around 5 to 6 submissions, which we are going to publish on 26th of the January this year. And now with the dedicated social media handles are also being launched today. Dr. Ankita Ashwarya is going to handle the Your Slides Facebook page. Dr. Ayushi Agarwal is going to handle the Instagram handle, and Twitter is going to be handled by Dr. Rakhi D'Cruz. So anybody who wants to know when to submit and what publications are going to happen, they can subscribe to these pages, and we will be updating it every Friday. And the submissions that came last year were finalized by Dr. Aditi ma'am, Dr. Krati ma'am, and Dr. Saurabh sir, and 6 finalists were chosen. And these 6 finalists were grilled by our esteemed panel of Dr. Digvijay sir, Dr. Sonal ma'am, Dr. Devakan sir, Dr. Karan sir, Dr. Apurva and Dr. Avnish sir. And we found out we had, out of 6, we had total 3 winners. So the finale was well attended by over 450 attendees across all the platforms. And the winners, the 3rd place goes to Dr. Ashwati Neena. That was the first presentation, first submission of your slide. She presented on keratoprosthesis. The 2nd place goes to Dr. Niharika, who presented on antiviral drugs. And the first prize winner, who is the last year winner of Yo Flash Note Award, Dr. Ayushi Agarwal, who presented on thyroid eye disease. So we will have a word from the winners and then comments from the senior. Dr. Ashwati, please. Dr. Ashwati is not there.
Hello. Hello.
Yeah.
Yeah. Thank you, sir. I'm really thankful for the opportunity. When I first heard about the Your Slides initiative itself, I was very interested. And Nilesh sir gave a lot of inputs, corrections. We went back and forth with the slides a lot of times. And it was really useful and helpful on deciding how the slides should be presented in the best way possible. Thank you, AIOS, for this opportunity.
Thank you, Dr. Ashwati. Dr. Niharika.
Good evening, everyone. Thank you so much, YOSI, for the platform, and especially Team Your Slides for providing us for the initiative and giving us wonderful slides this year. Thank you.
And Dr. Ayushi, your comments.
Good evening, everyone. Thank you, YOSI, and especially Nilesh sir, for this opportunity. The whole process of making a slide and submitting it, getting it reviewed, and then presenting it live, and the question and answer session, that was a whole was a great learning experience. Thank you so much.
Congratulations to all of you.
Thank you, ma'am.
Can we have some words from Chitra ma'am about this concept and how we can further improve upon this?
Well, I'm just continuously amazed at the so many initiatives which you are doing. So I was actually started thinking how ARC has to evolve more. So I think I'm not in a position to advise you all. Maybe I need to take advice from you all. I should get in touch with you all sometime, I think. Very good. Brilliant activities going on, and I'm sure you will go strong.
Dr.
That's so
Sonia.
generous of you to say that, ma'am. Thank you.
Thank you. Yeah.
Congratulations, Nilesh, on the wonderful efforts. And
Thank you, sir. Thank you, sir.
So let's have our next presentation by Dr. Avnish on the best late night retina case.
Yeah. Is my slide visible, Dr. Devakant?
Yeah, we can see it.
So before I start with late night retina, I just wanted to mention about the panels which we had for your flash notes. That was Dr. Akshay Nair and Dr. Prashov Mohan and Dr. Chitranjan Mishra. So these were the panelists for the your flash notes. Now coming to late night retina, actually the whole idea of late night retina started way back in April when we all were in lockdown. And I came up with an idea that we should actually have something which can focus more on case-based discussion for vitreoretina, as we have a very good learning curve. It takes time actually to go in to actually practice retina. And we still needed a platform where we can have an interactive and a more relevant discussion, and we can have an active participation. So that led to this idea of having a late night retina sessions, and we initially thought that we'll have it at 10 p.m. in the night, so that it's like people can come back from work, and it would be more relaxed sort of a discussion where we can have presentations, and it could be a very active participation from both sides. So this is when we started, and over the we have had 12 co-members, and these are the members. We have Aniruddha, we have Apurva, Ashish, myself, Bhavik, Chitranjan, Devakant, Divyansh, Jay, Dr. Komal, Remya, and Sharat. These are the co-members which I could get in. And over the past almost 9 months, we have had 16 episodes. We actually got it in 4 seasons. Like we had planned 1 season of 4 episodes and so on and so forth. We took it. Over the 16 episodes, we have had 33 presentations, and we actually went ahead. Initially, we thought that we would want to have participations among ourselves, and we can present and we can have a discussion. But as we grew in discussions, we came to know that we could have people from other places also. So we started inviting them for to send cases in relevant topics, and we had again had reviewed all those presentations, and the top 2 presentations from them were actually selected. So we have had 25 presenters apart from the core team members, and we have had 14 panelists, and of which 2 were also international. So these are some of the the late night retina presentations which we had. That was we had proliferative diabetic retinopathy, PVR, PVC, a couple of uveitis based case discussions, and then so on from there. And this was the last we have had almost 16 of the late night presentations. So looking forward to it, what we are thinking is we could have more case-based interactive sessions of what we had before. And as Dr. Apurva said, we try to push it on, we have it on Wednesday evenings, and we try to push for 2 sessions per month. But depending upon the availability of the presenters and the members, we try to push for that. And we are actually looking forward to have a workshop on step-by-step surgical retina, and maybe later on more specific or OCT based, or maybe case-based discussion workshops, which would be like a more part series which we'll have. And then as we started with focal points where we can give out some handouts, but somehow that we couldn't make it. So we would want to actually have some snippets about what the case discussions were. So coming to the presenter, the winners, we have Dr. Anirban Chakrabarti. He presented in the X-Files Masquerades episode 13. Congratulations to Dr. Anirban. Then we have Dr. Anamika Patel. She presented in episode 8, where the topic was challenges in pediatric uveitis, and we have Dr. Chavir Singh, who presented in episode 6, ERM and optic disc maculopathy. Dr. Anirban is presently the junior consultant at Arvindai Hospital in Madurai. Dr. Anamika Patel is a consultant at in medical retina at LVPI Vizag, and Dr. Chavir is doing his own practice, and he is the HOD at Mata Shri Netralaya Bhopal. So congratulations to all the winners. If we have Dr. Anirban, if you can say a few words, please.
Thank you, sir. I thank Yosi for the opportunity to present on this platform of Late Night Retina. And I thank the judges for this award. And actually the case was of creamy retinal vessels. And I thank my mentors, Dr. Naresh Babu sir and Dr. Chitranjan Mishra sir for their guidance in this case. Yeah, and thank you very much for the award. It really inspires us.
Dr. Anamika, if you're here, please say, can you say something? And how was your experience with the whole late night session?
Hello, am I audible?
Yeah, please.
Yeah, so Late Night Retina, when it actually started in the April last year, so I have been a constant attendee of the Late Night Retina, and the experience has been fascinating because all the small things that that we keep seeing in our clinics, and the way all those points are brought up in the discussion is simply amazing for the people who are just starting the practice, and and with all the experienced persons there. And when I presented, it was a case of Behcet's, actually, in a young girl who just presented with a hypopyon and the classical fern-like pattern that we had seen on the fluorescein angio. So that was a case that I presented, and so it has been a great experience, and I look forward to again to be an attendee in the future Late Night Retina sessions. Thank you.
Thank you, Dr. Anamika. Is Dr. Chavir here? Dr. Chavir? I think he's not there. So I think we'll go back to you, Dr. Devakant. I think all the episodes of Late Night Retina are available on YouTube. So I would like to thank Dr. Karan for that. And over to you, Dr. Devakant. Thank you. Thank you so much.
Thank you, Dr. Avnish, for this wonderful initiative. If Santosh sir is there, we can have some comments from him. Okay, I think it's Saturday night and it's getting late for everyone. So, Dr. Sona, let's move on to the next presentation.
I would like to invite Dr. Aarti Heda to share her experiences of the surfing the anterior segment sessions, and share the best case that was presented.
So am I audible and the slides are visible? So good evening, everyone. The goal of providing a direction to the professional careers of the next generation, YOSI has become the voice of young ophthalmologists, and we all agree to this fact. Serving the anterior segment is a case and a video-based webinar series, which was initiated in month of May, with the aim to discuss and understand the complexity of managing an ophthalmic case and providing a fresh perspective to the approach. So subspecialties we plan to cover include cataract, cornea, glaucoma, and strabismus. So let me give you a quick recap of whatever for our journey so far. So we have completed 8 sessions. First session was on corneal tear, wherein we discussed 2 cases. One was by Dr. Rajat and the other one was by Dr. Yogesh. Second session included a case of Steven-Johnson syndrome by Dr. Gaidik. Third session was concentrated on DRS, wherein Dr. Rajat has presented a beautiful case of DRS with upshoot. The fourth session was on trabeculectomy with an interesting case by Dr. Priyanka on overfiltration and its management. Fifth session was on iris claw lens, wherein Dr. Zain showed beautifully how to manage a case of IOL exchange with iris clip lens. Sixth session was on ocular surface squamous neoplasia, wherein we discussed a rare case by Dr. Dipanjali. Seventh session, we discussed congenital glaucoma, followed by a case presentation by Dr. Tamonash. Eighth session was on abducens nerve. wherein Dr. Ashwin Kumar showed us a surgical management of traumatic sixth nerve palsy. So I'm thankful to my team, all the panelists of all these sessions, young ophthalmologists who took all the efforts to make a wonderful presentation, and the audience to make the discussion so interesting. So a recording of all these sessions is available on YouTube channel for viewing. So keeping all these efforts of all so many people, Yosi decided to give the best of surfing the anterior segment award, which goes to Dr. Zain for his case on iris claw lens. So congratulations, Dr. Zain. Unfortunately, Dr. Zain had to leave for some emergency, so he won't be able to give his experience with us. So keeping up the journey ahead, we are determined to continue and in future with many such interesting cases. So our upcoming session is scheduled on 31st of January. So I invite you all to attend this. The session is going to be on cataract, and keep surfing with us. Thank you and good night.
Thank you so much, Dr. Aarti, and congratulations to you as well for taking this forward so beautifully. Dr. Digvijay, any comments from you on this concept, surfing the anterior segment?
No, I think it's a wonderful thing. I myself have been moderator in 2 of these strabismus sessions there, and it's a very nice concept that we're doing in Aarti, is making a lot of efforts and the entire team to keep it going. We just want the young ophthalmologists to come forward and send us more interesting cases. Your cases are indeed interesting, and no case is the same, so every case is unique. So no matter if you think how simple or straightforward it appears to be, every case is good. So please go ahead and send us those, and all these are available on YouTube, and you can all go and look at these sessions and all these series now, after this session, even if you haven't had a chance to view them before. And congratulations, Aarti.
Thank you.
And of course,
so much, sir. So next we have, as we learned in the international session, that's really important to reach out to people from different demographics. So last year we started initiating the formation of state chapters, and 2 of these state chapters have been doing really well recently. One is the West Bengal state chapter led by Dr. Vedang Shah, and the Assam state chapter led by Dr. Nilutparna Deori. They have been having really regular sessions, and so first I invite Dr. Vedang Shah to tell us more about his work and his team's work at AIOS-YOSI West Bengal.
Hi, good evening. Am I audible?
Yes, you are. Yeah.
And are my slides visible?
Not yet. Not yet.
Okay. Thank you for the opportunity, Dr. Digvijay and Dr. Divakant. I'm having some trouble. It's taking some time to load. In the meanwhile, I would like to share my experience about starting the West Bengal state chapter. I think is my screen visible now? Am I audible?
Yes,
you are audible, but the screen, yeah, now it is visible.
Okay. So amidst the lockdown, where we had so many other things and so many other UC activities going on, we also had the opportunity and the idea of the West Bengal state chapter, and we took the inspiration from the central body of the UC, and what started initially as just a WhatsApp group, very, very fast formulated into our YO committee of West Bengal. And this YO committee of West Bengal has been doing a lot of work in doing a lot of events and starting a lot of other smaller activities. And these are the core committee which is involved in doing these activities. And we have our secretary, Dr. Siddharth Bose, and our treasurer, Dr. Shivashish Das. And we have our academic in charge, Dr. Aditya Pradhan, Dr. Jyoti Mitra, and the executive members, Dr. Debanjan Sen, Saurabh Bose, Dr. Nandini Chandak, Dr. Prachi, Dr. Sagnik and Dr. Sneha. I would like to thank all of them for doing an excellent work. We started initially by collaborating with the state society, and we took them into perspective and had a very good meeting with them, and thereby they have helped us in promoting and doing most of our activities. We were the first state society, and I think probably the only society to be installed as a virtual ceremony, and thereby we also had our first academic session there, which was basically the management of diabetic retinopathy with cataract. Following which this ceremony was attended in huge numbers and was graced by a lot of senior members and the AIOS governing council as well, including Dr. Namrata ma'am and Dr. Rajesh sir, Dr. Mahipal sir, Dr. Patho sir. So that was a very good initiative and a very good experience that we had. Following which we had an academic session on cornea, where Dr. Samar Basak gave his experience, and we had a lot of participation there. This was the academic session of cornea that was held. We also started other initiatives, like we had the first ever virtual quiz, the Mind Bites. This was carried on for almost a month, a little more than a month. And during each week, we had quizzes that were out on every Friday. And we had our winners, Dr. Kaushik, Dr. Ayan, and Dr. Sugato Podar at the end of the 5 rounds. Next, we continue to have new initiatives like the Sunday Night Pearls. So this included the small pearls which were given out on every Sunday at around 8 o'clock. And the following week on the Saturday, the answer to the pearls were also given. So we had a lot of members and a lot of other people answering to the question that was given out during the pearl. We had our newsletter, the first of it, which was published in the month of November. And I think it was a great initiative under Dr. Devanjan Sen, who took the initiative of doing this newsletter. We had imaging, innovations, pearls, experiences. We had a guest column and a lot of things beyond ophthalmology also published in our newsletter. Finally, this was the last initiative, that was the trial frame, which included the salient features of the landmark trials. So basically, the trials were concised into short forms, and then they were published and sent across on the various platforms, so that it was easier for the students and the postgraduates to go through. We are looking forward to our next academic session, which is hopefully towards the end of this month. And I invite all of you to be a part of it. Thank you so much, Yosi, for giving the opportunity.
Congratulations, Dr. Vedang. We are fortunate to have Santosh Honavar sir with us, and if he can share some pearls of wisdom, he's such a illuminating fountainhead of ideas, and if his words of wisdom would really encourage residents and YOs at all levels to start their work on publication and other things.
Dr. Sonal, I think he has just left. He messaged me. I think he had to.
Okay, we just missed him once again.
Next, can we have Dr. Nilutparna Deri and to give us an update about the work done by the Assam State Chapter?
Okay. Thank you, Dr. Deva. I'll just start sharing. I think it's visible now.
Not yet,
ma'am. Is it visible now?
No, doctor, it's not.
Not yet.
Can you just click on the screen share?
Yeah, I have clicked on the screen share. It's showing sharing here.
I think there's some connective. Yeah.
Yeah, now.
It's there.
It's visible now? Yeah. So I'll go into full screen mode. So thank you so much, Dr. Divakant and the entire YOSI team for helping us from the Assam chapter. And I would like to say that we installed the Assam chapter on the 8th of September 2019. And following which we had collaborated with the Ophthalmic Society of Assam. And then we conducted a few physical meetings in the year of 2019. And after that, we went into the virtual webinar modes. So in the first instance, with the OSACON, we conducted a few topics like improving clinical and diagnostic equipment and all those stuffs that were included in the AIOS-YOSI forum, first initial forum. And we were helped by Dr. Avanish and Dr. Chintan Desai in conducting the entire session, and which was well attended. Just to have a good interaction with the residents of the Assam and the other northeastern states, we also conducted a photography competition for them, and and it went up really well. It was well attended by residents from across the northeastern states, and also the consultants and mentors from different state medical colleges also came up and encouraged us during that meeting. Following which, we also conducted the ISOC meeting in collaboration with the ISOC team, and where we had done a video competition. And the video competition, the theme of the competition was that it was not only clinical, but it was the experience the fellows had during their entire journey, how they started their SICS training and how they started their residency program. And it was really well appreciated by the seniors. And after that, we had also collaborated with the ISMICS group, which helped us to send 2 of our students in the Help Me See project to start with their virtual training, that is the simulated training program. During the lockdown, we started with the late night weekend sessions. This was actually inspired by Dr. Avanish because of the late night retina sessions. The students from Assam and the northeastern states, they were into COVID duties and they could not attend the sessions. So what we did was that we started every weekend on Saturdays at 10 p.m. started the sessions, and it went up really well up to 12 o'clock midnight. And following which, the attendees from these sessions also attended the late night retina sessions, and they were really helpful. It was really helpful for them to come up with their theory as well as their practical tips during their lockdown period. And I would like to mention that Dr. Namrata Madam came over during the OSACON, and she acknowledged all of us and inspired us to go ahead with this YOSI Assam chapter. And we look forward to releasing our bulletin in the next few months, which has been worked upon by Dr. Dipanjan Ghosh. He is the secretary for the society. Dr. Himadri is the vice president, and Dr. Purnima is taking care of the treasury as a treasurer, and Dr. Tanvi, Dr. Vikram, and Dr. Himadri, Dr. Himanshu, and Dr. Sovik are the executive members of the Assam chapter. I thank you once again for giving us this opportunity for helping the young ophthalmologists from Assam to come forward into the national platform. Thank you once again, and good night.
Thank you so much, Dr. Nilutparna, and I must really congratulate you and Dr. Vedang for leading these state chapters and involving more and more young ophthalmologists and helping them. I think we have come to an end of today's session. With Dr. Digvijay sir's permission, if we can have the vote of thanks and get ready for the tomorrow's session.
Yes, absolutely. I think it's a great thanks for everybody to have joined us, and we look forward to seeing you tomorrow. Vote of thanks for everybody.
Yeah, I think Dr. Karan would
thank all of you for all the participants for joining, and if Dr. Karan Bhatia can give the vote of thanks.
Thank you, sir. So good evening to all. Good night now, actually. It's my privilege to have been asked to propose a vote of thanks on this memorable occasion of the 3rd AIOS-YOSI Forum 2021. First and foremost, I thank our seniors and mentors from the All India Ophthalmic Society, Dr. Mahipal Sachdev, the President, Dr. B.K. Nayak, the President-elect, Dr. Lalit Verma, the Vice President, Professor Namrata Sharma, the Honorary General Secretary, Professor Rajesh Sinha, the Honorary Treasurer, Dr. Partha Biswas, the Chairman Scientific Committee, Dr. Chitra Ramamurthy, Chairman ARC, Dr. Santosh Hunawar, Editor Journal, Editor Journal, Dr. Arup Chakrabarti, Editor Proceedings, and Professor S. Natarajan, the immediate past President, who despite their busy schedule have found time to grace this occasion. Their continuous and always encouraging support is one of the critical reasons why YOSI and YOS of India are creating waves everywhere. I also express my heartfelt thanks to our President, Dr. Digvijay Singh, our Vice President, Dr. Sonal Kalia, our General Secretary, Dr. Devakant Mishra, our academic in charge, Dr. Apurva Ayachit, our treasurer, Dr. Avnish Upadhyay, and our executive members, and also our various sub-teams like the YOSlides team, the Surfing the Anterior Segment team, Late Night Retina, etc., etc., for their hard work in fashioning this wonderful and vibrant Yo virtual conference. We are immensely grateful to all our panelists and speakers. You guys are brilliant and you guys rock. It was an absolute pleasure to hear the stories of all the international Yos and their societies. I thank you for sparing your valuable time. We would also like to thank Mr. Kripal for helping us manage this global event with the most perfection. And last of all, I thank all the attendees for making it a highly successful event. And I would also request all of you to stay tuned for another fantastic program tomorrow. Thank you.
Good night, everyone.
Good night.
Good night.